We got Elizabeth. Okay. This. Get rid of this. This.
Yeah.
Minimize that. We're gonna get started. Our first speaker is Jo Pollak. She's a graduate of National University. She actually helped us teach Homeopathy 3 for a while with Dr. Burke and I. And her background is she first got an engineering degree and material science degree at University of Michigan, and then came here to National, got her chiropractic degree, and had a private practice in Naperville for a while. And also she was former president of the Illinois Homeopathic Medical Association. Then she got interested in a product, developing homeopathic products for injury after plastic surgery, and is founder and CEO of the company Ciarna. Now she's in San Diego, and she's developing products for aesthetics and other areas using homeopathic remedies. Also, she has a patent on a delivery system for one of her homeopathic products. So she's had to deal with the patent office and all that, and the FDA, et cetera, et cetera. So without further ado, Jo, I'll hand it off to you.
Thank you very much for that introduction. And I have no idea who's there, but many of you probably already know me. So thank you very much, and thank you for having me today. So my purpose of talking to you guys is to give you an idea that everyone's super worried about homeopathy, and you really shouldn't be. We will be in a better situation within our lifetime than we've ever been before. So let's talk a little bit about the patent, okay? So when I went to the patent office, when we first started talking, was probably 4 years ago. Homeopathy was considered pseudoscience by the patent office, and they refused to issue any homeopathic patent. Now, there are patents that mention homeopathy. Like you could, in their mind, if you did an herbal, it could be even a homeopathic patent, but they had to mention an herbal in order to get the patent, right? Because they basically considered anything was like dilution. There's no way in hell this works. We're not doing it. The problem with our patent is it didn't apply to herbals. So we had to basically look at them and say, no, it won't work. If we would have referenced herbals, the patent wouldn't have worked. We never could have gotten it. And so we had to actually go up to them straight up and say, no, you need to patent something because of the fact it works, and it works for homeopathy, and homeopathy is not pseudoscience. So what I spent an enormous amount of money, quite frankly, and time, was getting the supervisor of the art unit to actually look at the data that I had, and we'll go through some of that data later on. Look at the data I had, and also I had declarations by, like the former chairman of Northwestern's orthopedics group, the current, although she's now gone, but at that time, the current president of American Society of Dermatological Surgeons, she's now past president. I had to do all of that, and I basically had to convince them, because the data I showed them was at 10 to the minus 100,000, because it was a 50M. We, in the end, got that patent. And I'm telling you that this is a new day for homeopathy, and the patent becomes important in that. So what I've patented is, we've got a patent in the United States. It looks like we're going to get one in Japan soon. But we basically, these are products, arnica creams and gels. And so I gave a talk about what my patent is, and I'll briefly go through that right now. I didn't really cover that today because we covered it last year when I gave a talk. But essentially, we'll talk about it in general, but essentially, when I was practicing, I couldn't figure out, I'm like, we routinely, by the way, are the people in the room able to actually like speak? Or you have them on mute?
No, you can hear me?
Okay. Yeah,
Yeah.
I just, sure. Okay. I'm not used to people giving me feedback. So, what happens is I'm practicing homeopathy, and we use 50M potencies all the time, right? And so I couldn't figure out why there was no 50M gel. And honestly, just assumed nobody thought of making it. It was kind of a dorky thing to think at the time, but I did. And I tried to have it made. I actually had Washington Homeopathics mix me up one because I'm like, you know what? My patients, I'd love to have a 50M. I have a lot of patients who are children. And they made it and it didn't work. And so for completely the wrong reasons, I'll straight up tell you, I had the manufacturing process changed. And in that process, figured out the only way of making a homeopathic gel. And in fact, I will tell you, it is my belief based on what I know that Arnicare is herbal. It is not homeopathic. The only gels we have out on the market right now that besides ours are actually herbal in my estimation. We'll talk about that a little bit more in the future, but in a little bit later. So basically, we've patented everything above about a 6x, everything higher potency above a 6x in any form of gel, because it turns out the standard way of making them is not possible. And so that's what we patented. So so everybody's super worried because the FTC and the FDA, by the way, and I know the world of the FDA. I'm actually really, really, really glad that the FDA tightened up the regulations on homeopathy. Because what you have to understand is there's a number of people who are rogue, okay? We know within the homeopathic community, the least little, small little step, and we know this from the chiropractic community as well. The least little step we do over the line and hurt somebody, it ends up being blown up like we've just murdered 400 people, right? And so what the FDA did was they said essentially that topicals and orals are fine, but if you inject this stuff, you're out of what we've considered. And that's a very, 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 very good thing. One of the things I know is that when you do things outside of what we think and we have experience with, we have no idea how the body reacts to that. So injecting a homeopathic remedy into the body with some sort of a gel is actually a very bad thing unless you do tests on it. And so we want that because of the fact that we want to make sure that when we practice homeopathy, I don't think anybody in this room that I know of injects homeopathic remedies into the body. But there's some rogue people that do it, and if they mess up, it makes all of us look bad. And so I looked at how the FDA changed the regulations recently, and I was like, good job, because it keeps all of us that do normal homeopathy safe. So even though you think they're attacking us, I actually think they're helping us.
And when you're referring to the change in regulation, I'm not sure. I know they had the 2015 meeting to solicit to change the compliance guide, the CPG 400, and then they just recently, actually last December, they released a new guideline where they said they threw out that old guideline and they were going to do a risk-based analysis. And I think it's still up in discussion. There have been actually Homeopathic Action Coalition or something like that. Have filed a petition to have them relook at that and to maybe amend 400.400 rather than just throw it out. I mean, maybe you know more than I, but they would change regulation.
So, and by the way, and this is not my area of expertise, I actually would highly recommend that you have someone come in. There's a Leonard who basically is my consultant. He might be a good person to have you guys give a short talk and where that's at. According to Leonard, they've thrown out 400.400 completely. It no longer applies.
Exactly. That's the draft of the new guideline is to throw it out and have a risk-based analysis, which the guidelines went from being pages and pages to being very short.
So, and by the way, this isn't something I don't remember the references exactly, and it is, I believe, still a guideline. I think you're right. But a lot of people are like, oh, that guideline, the new guideline, the draft guideline, I believe it's a draft. I don't know if it's final. They're like, oh my God, it's really bad and blah, blah, blah. And it actually isn't, because what it says is we're fine with oral, we're fine with topical, and everything else you need to actually, but injectable, it is absolutely something where you need to go through phase 1, phase 2, phase 3. And I completely agree with that. And that's all I'm saying. The guideline people are up in arms about, I'm not upset with the guideline, the draft guideline. I think it actually makes sense. It does make us a little uncomfortable from the standpoint that that it leaves us kind of in a gray area. But what I've been advised, because I've been talking to people about the FDA, and I've been talking to people, understand the FDA over like 10 years now. The FDA the FDA cares mostly if you are going to hurt somebody. And that's really what their big deal is. And so people that are doing straight up homeopathy, like all of you guys are, they're not after you. They don't care. And they really don't. It's like, yeah, I suppose if they had tons of money, they might go after you because they don't understand homeopathy. But for the most part, they really don't care. And what you guys are doing is not something that they are likely to ever attack ever. And hopefully when we get through, what I'm doing, it will be not a big deal. But just realize that, to the best of my knowledge and understanding, and this is not an area I'm expert on, they're not trying to, nor do they want to attack what people are doing homeopathically. They don't have the money. They don't really consider it to be unsafe. They simply want to keep the rogue people out of it, because then you possibly can hurt people. And we want them to do this, because when people hurt people with homeopathy, which you really have to try hard, when they do like ridiculous stuff that nobody in this group would do, then it actually hurts us all. Does that answer your question?
Yes.
Perfect. Okay. Sorry, I went off track a little bit. So where we are today, not tomorrow, next week, or whatever, we may have possibly the largest number of leaders in dermatology and plastic surgery openly supporting a 50M product, okay? So yeah, 100 years ago, maybe 150 years ago, homeopathy was popular. I don't know what it was like then. I don't know. First of all, allopathic was not of the stature. It was still kind of bloodletting kind of world at that point. But when we really talk about allopathics, the leaders in that world, what I will tell you is I do not believe we've ever had the support that we have now. So I started this by basically telling doctors to use this product, and I would hide behind the fact that homeopathy is that we had a 1M. I mean, that it was high potency. I wouldn't tell them. I completely avoided that it was highly dilute. But I want to sell. So one of my companies I very much want to sell. I don't really like aesthetics. It's not my world. And so basically about 4 months ago, I added a medical advisor, and he was known to be relatively technical. And I went through in detail much of what I'm going to go through with you today, and made it very clear. So we already knew the product worked, but even, people can be like, oh yeah, I know it works. And then when you tell them it's a 10 to the minus 100,000, and they're like, okay, yeah, I won't stand behind it. No, I went through, I told them that it was 10 to the minus 100,000, and they still support it. We have, again, and the same thing with the patent office. They know the research I did was on a 10 to the minus 100,000. So I didn't do that until relatively recently. I'm now being very open with it. Even more, have you guys ever heard of Allergan? Imagine you don't know Galderma and MERS, but have you guys heard of Allergan?
Yeah, of course.
Well, not, yeah. So Allergan is I don't know, $20 billion company? No, maybe 5 billion, some ridiculous number. Galderma, probably $2 billion, and MERS a $2 billion company. So they accept homeopathy because it will make them money. My entire strategy has been get the big guys supporting us and we will win because they care about money. And only by partnering with these people do we become mainstream. And that's my entire plan. My entire plan is that we will become standard of care within my lifetime at every major hospital, most procedures that arnica would be used on. That's our plan. And so many of you are like, oh my God, the pharmaceutical companies are against us. Guess what? We're a nit to them. They don't even think about us. Sorry, you may think so. No, they don't even think about it. But the important thing is I've given this same presentation to all of these people, and they still are talking to doctors and saying, does this work? Okay, yes, we're still interested. That is further than I think we've ever been in my lifetime, certainly, anything I know of. So I'm going to stop there for a minute, and I'm going to go through now with you what I have shared with many doctors and certainly the three big and pharmaceutical companies in my space. Before I go through that, any questions on what I just went through?
Is it clear to everyone when she gets by 50 resolution, how she gets the algorithm? So it's 50M means it's 50,000 C. A C is a 1 to 100 dilution. Take one drop, 99 drops, shake it so many times, that's a 1C. You do that 50,000 times, and that's a 10 to the minus 50,000 times 2 of 10 to the minus 100,000 dilution. It's very diluted. I mean, it should. The skeptics would say, oh, it's way beyond. Once you get beyond a 24 or 23 or 24 C dilution, or 12C actually, where it's 10 to the minus 24, you should have diluted out the active ingredient. So it's way beyond that. Is that clear? Any other questions? Yeah, we're good.
Okay. So realize for what Tim just said, with that concentration, they should be like, yeah, go away. But they're not, because what my entire plan was get the top doctors in the country completely supporting the product. And this, by the way, is the product. It's a pad. It's basically arnica in a pad. It's a 50M. And again, I gave a talk, I didn't repeat stuff that I talked about last year, but it turns out that the time of applications matters dramatically in homeopathy, actually far more than conventional drugs. So what I do is I take a 50M and I apply it on the skin for like 12 hours. This one was applied here. You can see this line. This was applied for 24 hours straight. And the results are overwhelming. And again, I didn't go through, I didn't bring that stuff, but the results are overwhelming on how effective it is. So the first thing when I go through this is I go through my background with them, because this presentation was designed to go to their technical people. And what I basically talked about is my engineering degrees. I've got 3 of them. And try to tell them, no, I'm not, a lot of the reason that I ended up getting the patent is I had to spend years actually developing a rapport with the patent examiner supervisor, the patent art unit, they call it an art unit, the division supervisor, to make him realize that I have a strong technical background and I don't tend to be somebody that, makes things up, right? So I spent a lot of time, and part of the reason why this is in here is because of the fact that I didn't even remember this. This was in my 20s, and I was appointed to corporate boards based on my technical expertise. And so that's really what this is about. It's like, guys, realize I'm not different than you. I have lots of technical background. I'm not just somebody that makes stuff up. And so what I tell them, it's like, listen, I get that the controversy is about it being highly dilute. And paradoxically, higher dilutions result in a higher biological effect, which is completely contrary. You have to understand the people I'm talking to are steeped in traditional drug development. And one of the problems that we have with homeopathy, I see a difference in people. What I find is engineers are relatively okay, and physicists for sure are okay with understanding paradoxes. Traditional drug development people come out of the straight up science of biochemistry, and for reasons I don't really know, that personality type tends to be someone that if somebody hasn't told them that in 14 papers, it's not true. They don't tend to be innovators in general. And so I just needed to get them to understand that something has to be possibly working. So I straight up tell them our potency is a concentration 10 to the minus 100. Okay. So straight up, it's very unlikely 10 to the minus 100,000 is going to have any biological effect. That's a fact. Okay. So, and then I hit him with this. Okay, he used to be the president of American Society of Dermatological Surgeons. She just recently was, and it turns out that one of them, there's another guy, and apparently he ended up off this picture. But these people are the people that are constantly on the podium speaking at plastic surgery and dermatological conferences. This guy used to be, I don't know if he still is, he was on the board of the ASDS. And then Sue Ellen Cox, wherever she is the secretary of ASDS. He's one of the top, Lori Klein is one of the top injectors in the country. She is known as the queen of derm. He's considered to be the king of derm, or actually the godfather of derm as they talk about it. But the bottom line is, and I straight out, either these people are delusional or homeopathy works. So Allergan's been calling a number of these people, and everyone says the same thing. This stuff really works. For them to put their reputation on the line, realize it's that. For a 10 to the minus 100,000 product is a big deal. Does everyone get that? It's getting to the people that matter. I could have had, 150 random dermatologists and plastic surgeons, and it really wouldn't have mattered. These are the mover and shakers in the industry. And so what I say to them, there must be another explanation.
Joe, I just want to comment. Kudos to you that you figured out in medicine. That's exactly how the pharmaceutical industry innovates, is they get thought leaders, people at the peak of their profession in their respective specialties, and gets them on board and gets them to use the product and then teach it and explain it to their colleagues. That's exactly what in standard pharmacology, what they do, how the pharmaceutical companies get drugs out there. So kudos to you for, you figured that out, and you're doing the same thing. You're playing by their playbook and being successful.
And so thank you for that, and I appreciate that. And that's exactly what I realized. We can all play around in our homeopathic world, but we were never going to make it unless I have to tell you, I spend my life in the allopathic world to the point where I saw a talk by Wayne Jonas recently and realized I'm not in the homeopathic world anymore. I spend 99% of my time talking to regular MDs, none of which have any homeopathic background. And I work, because of my corporate experience, I work in that world very well. I understand what the driving forces are, which is money, by the way. And I'm working it. I don't talk to them about, oh, it's really awesome, although I really, really, really care about homeopathy and that's my end goal. I talk to them about money. And in fact, this group, you probably don't know any of these guys.
That's not true.
Bob does.
Bob.
Who do you know, Bob?
Some of these guys, Bob? Who do you know?
Well, I'm not like,
Because you're in med derm. These guys are not med derm. They're all aesthetics derm, and it's a different group.
Well, we've got all the right people on the slide, Joe. That's very good. I mean, because these are the people that do a lot of cosmetic derm and talk at all the big talks. So no, if you can document that they all use it and they like it, I mean, that's great. You did all the right stuff.
Yeah.
Textbook influencer marketing.
I talk to, or I email back and forth. I communicate with Roy all the time. Like we were just emailing back and forth, and he's like, yeah, this is the best product. We're trying to figure out marketing words, and he's like, yes, this is the best product for bruising, period. For him to say something like that is worth $1 million, because he, as well as this guy, and this guy, Sachin and Roy. Sachin's, by the way, a plastic, not a derm. They speak to the president of Allergan all the time, like on at least a monthly basis. And Sachin even more than that. So we have a choice. We can either try and stay in our homeopathic world, or we can address it in the world that they live in. And that's what I did. I basically got the leaders in the industry to support it, not telling them what it was in the beginning. I'm not a complete fool. And then only after they were completely convinced of it, like I had Roy call. So currently people bruise like about 66%. Roy's probably less than that. And I had him call every single one of his patients. This is for dermal fillers. And basically after he got to 40 and nobody was bruising, he's like, okay, I'm convinced. And he's absolutely 100% behind us. And that's what's going to matter. It's using their playbook. So there must be another explanation. And so what I talk about, and let me be really clear, the patent is critical to this. If I didn't have the patent, which I got earlier this year, they would not be talking to me. It's money. We needed to get that patent, because otherwise the big companies would not be looking at us. Because if you can't patent it and you can't make sure they're going to make money, they're not going to care. And the real reason why they've never done anything in homeopathy, it was relatively unpatentable before. So this is one of the other things I talked to them about. So first of all, when I was a homeopath, Arnica's been around for 100 years. I don't know when the first gel was, but it's probably about 100 years ago the first gel was made. Why the heck wasn't there a high potency gel? I didn't know. Okay? Tried to make it, didn't work. And for reasons I really didn't know at the time, I couldn't figure out how to make it, right? So what I accidentally discovered is that, and this gets into some deep technological stuff, but does everybody remember their hydrogen bonds from way back in chemistry 101 or whatever it was? So when you have a gel, essentially envision that the hydrogen bond is held in place. The hydrogel basically holds that hydrogen bond so the water molecule doesn't move. Okay, that's what gels do. Okay. In traditional methods, you add arnica in the end. You have a gel base and you add arnica in the end. You add about 7% of it actually. Well, I had thought, oh, well, it'll be fine. There's lots of water in there. I figured out that water was critical to our homeopathic remedies. And I'm like, oh, there's like 90% water. They should be fine. No, it doesn't form. You know how all of us can graft remedies, and we've known that forever? You readily have arnica or whatever homeopathic remedy in any water base, a water solution. It'll make what I now know as nanostructures. It will not make it in a gel base because those hydrogen bombs are held and they cannot form whatever structure needed to be formed. That is not super critical, but does everybody understand that?
So I think when your last presentation, I mean, some of the people probably weren't here. It's like if you try and make a gel with a high potency, if you make the gel first and then add the homeopathic remedy, it doesn't work. But if you add the homeopathic remedy to the water first, allow it to form water nanostructures, and then make the gel, it works.
Yep.
I mean, that's kind of proof, that's proof that, like you said, the nanostructures of the active ingredient are actually not the active thing. It's the water nanostructures.
Yep, that's basically. And so what Tim just talked about is, so what I had done purely for the wrong reasons, I need to straight up tell you, is I had the arnica added before the gels were, before we had the hydrophilic substances in the mixture. And so I basically made a huge vat of water with all our homeopathic water. And then I add in the hydrophilic gels, and then you gel it. So when you cross-link it or gel it. And so, and nobody understood that that was a critical step. And that's what I patented. I patented the fact, basically our patent, by the way, and the patents are ridiculously broad. It's anything above about a 6X in any form of a gel. And it basically says, because of the fact that this is necessary in order to make them, is that if you cross-link, or, and this is what you do for making gels, if you cross-link or polymerize a gel after adding the arnica, I own anybody that does that way. And so what I'd realized, so what I had hypothesized, I'm like, why would this matter? You have to understand, when I went into this, I didn't know. I just did it because it was easier to manufacture, as a matter of fact. And when I realized all of this, that adding it before works and adding it after doesn't, I basically hypothesized, and so I'm a material science, that's my background predominantly. So I think about structures, and I think about molecules, and I think about how things are structured, and I'm like, oh, there must be a structure that's formed that becomes the active ingredient in homeopathy. Okay?
And to be clear, Joe, that structure is, in this case, is a water nanostructure.
It's completely water, yes. And this is a little bit over the top on this particular aspect. So one of the things, I randomly run into things that I need to know. So I was talking to someone in LA who is apparently a specialist in this area. And what he told me is that whenever we see a molecule of a drug, it actually is generally incomplete, because apparently, and by the way, this is not my area of expertise, so I know this only in a very vague way. He said, in fact, the interaction of a drug with the water around it and the water in your body actually is the complete drug. But they never show the water because it's not critical. But people that apparently know drugs, the binding of the water actually, and the hydrogen bonds in the water are actually critical to the effectiveness of drugs overall. I think that is why homeopathy, I believe that that's connected, although I really don't know. It could be completely unrelated, but I think that's connected to why the nanostructures form. So essentially, and it becomes important when you guys think about your homeopathic remedies. We form them, and in some form or fashion, when they're diluted, and I actually believe that this is formed when they're being made back at the manufacturing site. The nanostructures are probably formed then, because all we do, you know why Hahnemann put them under our tongue? Because there's water in your mouth. Your entire mouth becomes a homeopathic dispensary, because the pellets, this is, by the way, all theory on my part, nobody's ever confirmed this, but the pellets put in your mouth, you've got a lot of water in your mouth, and because of that, you have nanostructures that form completely throughout your entire mouth when you dissolve it on your tongue. You put it in your stomach, and I don't think they probably, I don't know this for a fact, but I suspect that they don't form as readily because of the situation that's in the stomach. I don't really know that, but I'm guessing that.
So John, what you're saying is there has to be a lot of free water in the mouth, because if it's structured water in the mouth, it won't work. It has to be free.
Mm-hmm. Yeah. And you know the whole thing about not eating before or after? It's because you rinse your mouth out when you eat. afterwards, and you rinse the nanostructures out. Or I don't know about mint. Mint doesn't make sense to me. But for instance, not that this any, but if anybody, if your water and your molecule is all bound to some, like if you had a hydrophilic substance in your mouth, my guess is homeopathy wouldn't work as well, because you actually, the hydrophilic substance, meaning a gel, would probably bind the water to some degree. So yeah, you absolutely have to have free water. So the point is, hydrophilic substances bind the water, and I theorized that there must be nanostructures there that are formed within the water, right? So I completely guessed this based on what I know about what I know about hydrophilic substances. 3 years later, and actually this was partly because Tim, so months after this, Tim had introduced me to a guy named Jerry Pollak. And then 3 years later, Jerry Pollak introduced me to this guy named Konilov, who basically sent me the photos, and we'll go through his research. But basically he shows nanostructures that I had predicted, and they're completely water-based. So what I think happens when at the manufacturer they're making the nanostructures, if for some reason, and I really don't know, that as you dilute them, the nanostructures stay as the original substance goes away. Now you have lots of theories out there. There's a silicon theory. There's this theory that silicon in the glass water will form a structure. There's also an idea that you actually retain 1 or 2 molecules of whatever original substance. What I will tell you is, based on my observation of transdermal delivery that we have, that's bullshit. Sorry, but it really is. I don't know if I'm supposed to swear on this recovery, on this tape, but the reason why
they've shown in, like I saw a study published in Homeopathy, that up to cm, for lycopodium, they've shown nanostructures. But I think the important thing about your research is okay, you have nanoparticles of the starting material, you could say.
Yes.
But the important thing of your research is that's not the active ingredient. That you need the water nanostructures.
The water structures are our active ingredient. And the reason I know that, okay, is in transdermal delivery, if you have a large molecule, it doesn't go through the skin, period. If it was silicon molecules or if it was the original substance molecules, you can't get them through the skin. Our products, homeopathy, readily goes through the skin in a minute. Like original stuff was just a water base. If their theories were true, the skin would be a barrier. It's not. And so they have lovely theories and they're wrong. It is, maybe it's a different nanostructure, I don't really know, but it's definitely not original substance, because original substance would work the same way that normal, herbal molecules, and they don't go through the skin readily, not to the level that you see here. So the key is, let me just jump to a little bit more on this, is I suspect, but do not know, that all we're doing is hijacking something that already exists. What I suspect is that when you ingest a substance like arsenic or belladonna, if you ingested a herbal level, a toxic level, or whatever level of it, these nanostructures are formed in the body naturally, I suspect. And that all we're doing is basically adopting a messaging system which is already done in the body. And all we do is amplify it, which is very, very consistent with what Hahnemann talked about. How Hahnemann figured out all this stuff, I honestly am continually amazed by what he figured out in such a short period of time. However, basically what I think is we just simply amplify everything I've ever known as a practitioner. It looks like we amplify a body's normal response. And what I suspect is these nanostructures are actually a messaging system that the body has always had, to the point of where we were amoebas. I was talking to Wayne Jonas one day, and he said that homeopathy works on organisms that do not have immune systems. Thus, it's not immunity response. I suspect this is something that was figured out when we were amoebas, or when the species was, whenever evolution was amoebas. And so for some reason, but I don't know why, but we form them in any water situation. Although that's like, so part of my long-term goal is use a patent, make enough money, and probably fund more homeopathic research into this than anybody has ever done in the history of our world. And that will be what will bring us through the mainstream. Okay.
Joe, that's an interesting observation, because it's interesting in Gerald Pollak, he has on a YouTube video it's really cool to watch, about, I think, cells, gels, and life or something like that. But he basically says that structured water, when you have, like you said, when you have water, you have light, and then you have a charged surface, that water gets structured. And he believes that that's how people are trying to figure out the origin of life. Like, how did all these proteins and DNA, how did it all get together and form a cell? It's like, there's so many possible combinations. It's almost like theoretically impossible. But his claim is that when you have like a rock or something, and you have water and you have light, you're going to have structured water, and that's going to bring all those molecules together. And so the structured water was there from the start, according to him. That's how life originated, in that structured water in the ocean.
That's an interesting concept. That's an interesting concept. That's very interesting. Yeah, I can see, because it basically.
Well, from the start, your point is well taken. It's since the single cell, since the cell formed, structured water has been there. And then in his book, he talks about how actually structured water inside cells explains a lot of the processes of cells, like muscle cells and how they contract. And it's like water structuring and unstructuring within cells. That's vital to the function of individual cells.
Absolutely.
Yeah.
So what I am positive of, and you and I have talked about this, is Konolov, or I don't know if Konolov was the first person that talked about it, but whoever was the person or persons who fundamentally can demonstrate this research to the point where the mainstream is comfortable with it, they will win a Nobel Prize. This is the stuff of Nobel Prizes, because what I'm positive of, I'm on a path to mainstream within my lifetime homeopathy, so every single hospital considers it standard of care. I honestly will be shocked if that doesn't happen, because we're on that path right now, which is so much further than we've ever had been. And we'll do it by following, we're going to play within their rules. We're going to do evidence-based medicine, and ARNA can do that, and my product can do that. And when we do that, it will make it so arnica will be used in every single hospital, emergency room, surgery suite, whatever. So to your point of basically the nanostructures is, so what I say to these people, this is very important. I came up with this theory, and that's the only reason why I'm able to patent what I'm able to patent. And Konolov, completely in a different country, don't know the guy, came up with it completely separately. Now, I've done a ridiculous amount of troubleshooting in my lifetime when I was an engineer. And what I always knew was when two completely different people pointed to the same thing, assuming they're both, rigorous in their assessment, that almost always points to what is really going on. So let's talk about, now we're going to go to Konolov. So first of all, no one in research will go below Avogadro's number. It is a death kill for any research you ever want to do, period. They will not go below around 10 to the minus 19th. So just know that. When I have lots of money and I don't care about research grants, I will. But the research that you'll see out there is only going to go to about 10 to the minus 19th. So dynamic light scattering, when you've got 10 to the 19th molecules of water and 1 molecule of your substance, you should not get a dynamic light scattering peak. And in fact, they show it in other ones that they don't. So here you have at 10 to the minus 19th, virtually almost no molecules of whatever original substance. I don't even know what this was. Oh, Tim, do you know what this drug is?
Alpha tocopherol, that's vitamin E, right?
Oh, I have no idea. I
Alpha
didn't.
tocopherol, vitamin E.
Okay. Here
We
I
have a lot
thought.
here on that stuff. So everyone agrees, vitamin E.
Okay, well, I thought it was some fancy drug, given that I don't actually know these things. So there's vitamin E. Okay. If you've got one molecule of vitamin E and 10 to the 19th molecules of water, you're not going to get a peak. It's going to be in the noise. There's going to be so few molecules of vitamin E, so you shouldn't have a peak. So what are these peaks? They don't make sense, right? Well, thank God for atomic force microscopes. So every single other, it turns out I used to work in electron microscopy when I was in college. So I actually know, I don't know anything about atomic force microscopes, but I know about all the other stuff. Every single other investigation tools where you could possibly image this requires a vacuum. You can't image something, water, when a vacuum, because guess what? Creates a vacuum. Doesn't work. But you can with atomic force microscopes. Atomic force microscopes do not require a vacuum. And so what you have is, this is actually Konolov's, and this is actually Ho's work, or actually it's Lowe's work that Ho talks about. But basically they image these nanostructures you see in the waters. These should not be there. You should see a relatively, unless there's other substances in, and they should not be in any quantity. When you've got you've got nanostructures, you've got dilute water, you should not see these clusters. And going to Jerry Pollak's work, basically Jerry Pollak says water readily becomes structured. And what's kind of shocking to me is they're really actually very stable. So picture how we do our manufacturing. We make the nanostructures in a big vat, and we throw it through. We add hydrophilic substances, and we have the hydrophilic substances which soak up the water at that point. But those nanostructures are still there, and they're still stable. That actually kind of surprised me, actually, when I thought about it. But they are actually very stable, and it's consistent with what we see in homeopathy. So, in the absence of nanostructure, you see this line here? So this is surface tension. In the absence of nanostructures down below about 10 to the minus 10th, you should flatline. Nope, we actually see in the presence of nanostructures that the surface tension changes. At concentrations of 10 to the minus 16th, you have one molecule of the original substance, 10 to the 16 molecules. That one molecule is not going to affect surface tension. It's these nanostructures that are formed that affect the nanostructures. Affect the surface tension. Same thing with conductivity. This flat line, that's pure water. That's water that doesn't have nanostructures in it. But in the presence of nanostructures, you see that the conductivity changes. If it was due to molecules, in the very, very few molecules, you would not see this effect. So in the end, what I tell them, the nanostructures seem to be in sufficient concentration to explain the bioactivity. I theorize that the active ingredient, I don't know, I've not done enough research. Nobody's done enough research to do this. It's theorized that this causes the bioactivity, and it's definitely tells us why binding water molecules would impede the biological activity. The binding of the water molecules into a gel would prevent the water molecules from forming these nanostructures. Everything is consistent. Now, I tell them, because you got to remember, these guys are used to seeing whenever anybody presents something to them, like 700 papers, it's like, guys, realize the reason the research isn't here isn't because it doesn't work. It's that both economic and we all know the political factors will limit the research. And we know there needs to be additional research, but this does provide a plausible, I can't say it's absolutely true because these people would laugh at me. So, in conclusion, and remember, this is a presentation given to VPs at Allergan. The mechanism of action is not clear, but you have doctors out there saying, I will stake my reputation that this actually works. And then the economic factors, which is a decrease in downtime will increase the amount of product that they get to sell. And bottom line is, if we make it standard of care, you will make money. And that's it, guys. Questions?
So Joe, if we wanted to go out and buy it, or if we had a colleague that wanted to buy it, do we just call the number or email that over there to buy it, or how do we get it, and how much is it for, let's say, the box that you showed that?
So you actually call this number or email this email address. And so it's super expensive. It costs a lot to manufacture. We actually don't make a whole lot of money on it. And so for a set of pads, a left and a right, it's $13.50. So it's not something really for OTC. It's too expensive for that over the counter. But it works very well in these plastic surgery world because filler procedure is like $1,000. And so, yeah, you can have people contact this number if they want to buy.
Okay.
So how much is that? So you said it was how much for 2 pads?
$13.50 without discounts.
So that box that you're showing there now is 15. So that's how much for that box? That's like hundreds of dollars.
It's actually now 13. This is an old box. It's $175 a box.
And it has 15 pads. 15.
It actually now is 13. I need to probably get another picture put in here. It's actually now 13.
Okay.
Yeah.
13 pads.
Yeah.
Are the pads reusable, or is it a one-time use?
No, it's a one-time deal, and they only apply for 6 hours because you have to keep a certain amount of water content in them. And so they'll stop working after about 6 hours.
Okay.
But guys, you know what all you guys do? This is what I did with patients all the time. Take 2 pellets, putting in 4 ounces of water of whatever you need, soak a paper towel in it, and cover it with Tegaderm, or what I use is Press and Seal. And as long as it's wet, it's working. So you guys don't need to use this product. I would for my patients. That's what I did for ages with my patients. As long as you've got those nanostructures and you've got a reservoir of water, it's deploying and you will see results, which is unbelievable. It's way better than anything I'd ever seen. I mean, I remember, is Joel there?
Yeah.
Yes.
So I remember Joel one time, and this was years ago. It was, I think, when my son did a flip on a trampoline, and Joel says to me, he's like, Joe, we didn't know we could prevent the bruising. We always assumed it would come out really strongly, and then it would get better. We didn't know we could prevent it. Do you remember that conversation?
No.
Because we didn't know. And so the fact that you can prevent bruising, like all of us would have expected, and I also kind of expected, that what would happen is the bruise would come out really, really badly on day 1, and we'd resolve it by day 2. The fact that we bruise, or the black eye in this case, when I was talking to Joel, was unexpected. Or the swelling, I personally prevent the swelling.
So the surgeons who are using it, they're using it to actually not to treat bruising, but even to prevent bruising.
Oh, they use it.
So the effects are so dramatic. People are not getting bruising when they would normally.
Yes, and actually we are better. Arnica is better. I've learned a lot about things. Arnica, so a couple of things I've learned, or things I know you may not know. Black eyes, Arnica does not work on. You absolutely have to have Ledum. And I actually suspect that Ledum resolves bruising. I don't believe Arnica does, but I'm not actually 100% sure on that one. But no, we're way better at preventing than we are resolving. Like I can prevent completely a bruise, but if somebody's already got a bruise, you can maybe improve it by like 30% the time it resolves. And I'm guessing 30 to 40%, depending on the bruise. But yeah, put it in water, treat your patients, and just topically apply it. Go ahead.
Oh, Joe, so what I was wondering is, so if you have an aesthetic person and they're injecting a filler, or they just instead of blepharoplasty or something like that. So when do you put it on? As soon as they're done stitching or done with the injection, like boom, right now?
So there, length of time matters tremendously in homeopathy more than it does in allopathic. And so the procedure for fillers that we use is we have 4 pads on the face. They apply it for either 12 to, depending on the patient, how long of a bruiser they are. So most people get 12 hours, but about 20% of them get 18 hours, but they replace them every 6 hours. So if you want to guarantee it, it's 18 hours straight out continuously, and almost nobody bruises. For surgery, since it's more trauma, it's 6 pads on the face for 48 hours, again switching it out every 6 hours.
But so as soon as they put the stitches in, then they put it on after that?
As soon as you, yep, you want it on immediately afterwards. The longer you delay, when that bruising, if you longer you delay, the more likely they're going to bruise.
So I mean, it's common for surgeon, they finish the suture and then they put a dressing on. So you put this on first and then you put the dressing on, basically.
Yeah, absolutely. In a lot of cases, they don't put dressings on, but yeah, they basically.
This is the dressing. This is the dressing.
This is non-sterile. As soon as the sterile field's done, they put it on.
Can they put it across the wound?
What's that?
Can they put it across, if there is an actual incision in the skin, can they put it across that, or it's better to keep it away from an incision?
It's non-sterile. We tell them not to use it on incisions. There's I don't have it, but we train people. We basically tell them don't put it on open wounds because it's non-sterile. Don't get it wet because the hydrogel will basically fall off if it gets wet. Get it on as soon as possible. Keep, all those things. Yeah. The key is for you guys when you're treating patients, get it as soon as possible. So it's really good for sprains and strains. This product is not. So I don't have a presentation. If you have a patient with a sprain or strain, arnica, ledum, rus tox, and ruta, put 2 pellets in each in a mixture, roughly 2 pellets per 4 ounces of water. And basically, I literally take paper towel, wrap the whole entire limb in it, and the results will be shocking to your patients. You're crazy if you guys are not using this because it works.
Arnica, ledum, rus tox, and ruta.
Yep. And sometimes if it's a nerve thing, obviously hypericum. But most of the time, I don't see a nerve thing involved. And also, you ever have a patient that is in danger of like one of the things I'm going to do, I didn't bring this out to begin with, but spinal cord or any nerve or nerve damage, soak them in hypericum. Highest potency you can possibly find. 50 M I know works. Not 100% sure 100 M. I can't tell you why, but I've had a case and I'm not sure why it didn't work. It might not have been related to the remedy, but 50 M, basically you have a friend or loved one or somebody you care about. I've made arnica baths. Honestly, what I do is if I worked out really, really, or I'm really exhausted, what I'll do is I'll put pellets into the flow of the water, kind of the Finke method. And I'll basically make an arnica bath. Works great. But if I had a loved one that I was really worried about something where they might have had trauma, the things that will affect your dosage is obviously the potency, square area, and time of application. Those are the 3 factors.
How far beyond the pad does the effect work?
At least 6 inches, we know. We did a study accidentally, quite frankly, and we found out that it works 6 inches, but I don't know how far it works in totality. And it seems to attenuate at that point too, a little bit. So it's not as effective 6 inches out as it is underneath the pad, but it still works at least 6 inches out.
Joe, have you considered, the plastic surgery market, obviously in the United States, it's a good market. But in terms of sprains and strains and contusions, and everyone gets those multiple times during their life. Have you looked at bringing out something that could be in Walgreens that, people could use. Because I mean, like you're saying, we can make this ourselves, but most people don't know anything about homeopathy, whatever. But I would think that if people saw that these products, if they were specific for a specific strain or bruise in a certain area, they would buy these gels, that go to Walgreens and buy them. It seemed like it works so well, it'd be a great seller. And the market for that would be, I mean, everyone who doesn't get a bruise at some point in their life multiple times.
So there's a couple different factors. First of all, it was a business decision. Thank God to Hahnemann Labs and Cynic, the plastic surgery and derm world had already been using arnica, right? So it's a matter of, I have no money. It costs so much money. By the way, you guys want to make this happen? You know anybody who's really rich and would be interested in investing? That's the problem I have, is that I'm a homeopathic company. I'm a female, 2 strikes against me completely. And so raising money has been horribly difficult. I've become a pauper over this company because I think it matters a lot. But really, Tim, when we decided this close to 10 years ago. And we looked at all these markets and we basically looked at what is it going to take to go into them. So the problem with the sprains and strains is we knew we had to get the orthopedics behind us. And the orthopedics are the most conservative, whereas thank God to Hahnemann Labs, they had already, been using, like most plastic surgeons and dermatologists were using an arnica product. They didn't always know if it worked or not, but they were comfortable with it. Whereas if I tried to go to orthopedics, they'd be like, "Are you crazy?"
I shut you down in a minute. But I think the way you did it was brilliant because it was just the market waiting to happen. It just had to be the right person, right time. But I'm saying, like, when you're maybe approaching companies trying to sell this, you need to let them know the potential is much, much greater.
Let me finish. I'll get there.
Some variation of this product,
Give me a minute, I'll get there.
Yeah, good.
So basically, I made a business decision to go into aesthetics. So I have 2 companies. I have what I call Inc., which owns all of Arnica. And you're right. I stopped counting when the U.S. market reached around 30 billion. Okay. I'm like, okay, I stopped counting. But I made a subsidiary, aesthetics, and the plan is sell aesthetics for a lot of money and use that money to fund the research that I need to do exactly what you're talking about.
Wow.
It's a matter of everything that's limited me has been money. I would have done 1 million studies. We couldn't do studies because they're very expensive. Like a rigorous study can be $1 million. I didn't have that money. And so everything I've done has been limited by money. So you're absolutely right. So the plan is, since I knew, because you imagine you go to the people who invest, you bring up the fact that it's homeopathic and they'll laugh you. They're like, what? They're always looking for a reason not to invest, and being homeopathic was one of them for sure. And so you're absolutely right. The bigger market is the sprains and strains, but the cost of going into them. So aesthetics I've done with, a couple, probably $3 million total. Most people are in aesthetics would start with 20 or 30. So the fact that I've accomplished what I've accomplished with $3 million is shocking. But if I would have tried to go OTC, you've got to advertise it, it's expensive, etc. Everybody would tell me it's like $100 million process. I didn't know how to do this. Guys, when I started this, I was no different than you guys. Can you imagine trying to figure out how to navigate marketing and sales and manufacturing, all that stuff? It sounds like it should be super easy. I actually thought, stupidly actually, as it turns out, I actually thought that if I just introduced this plastic surgeons, they would realize it works really well and we'd be selling 20 million of them, 20, in a week. Not quite that naive, but it's really a matter of money. If I had the investment, so one of the things I know, if we were a drug, we would have been acquired by now. And 2, if I would have been a drug and not a female, sadly, we would have $50 million invested. But because of the fact that we're homeopathic, they don't invest in it. So it's really all about money.
No, but I think it's fantastic what you've done, and as things are. We had Jennifer Jacobs gave a presentation to us, 2-3 years ago, and she's done some pretty incredible research at University of Washington on homeopathy for diarrhea in children, very good studies, and she can't get funded anymore. I mean, the money basically dried up for homeopathic research. So in that environment, the fact that you could, Wayne Jonas is a great supposed advocate for homeopathy, but where's the research on homeopathy? It just isn't happening. So the fact in this kind of environment, you could bring this product out and have it so successful I think is phenomenal.
And so this goes back to the patent. Unless we have a product that can make money, we don't do the research. And that's why the patent was so critical, because if we can make money on it, so my plan is to start a foundation which will do homeopathic research. And again, not take people out of the homeopathic world to assess with the research. I have to tell you, I've looked at the research that homeopaths do. Jennifer Jacobs is, by the way, a very strong and clear exception to that rule. It's not everybody. But some of the research that we do as homeopaths, it's like, are you kidding me? From a researcher standpoint, I'm like, why would you even do that? The number of arnica studies which are underpowered is, like, I actually had written a paper on, I looked at all the arnica studies, and they would basically take and hit somebody with a baseball bat and then use like a 6X. And you're like no real homeopath would ever do that.
But I think a lot of those studies I saw a study on arnica after like heart surgery and stuff like that. It was a negative study, and it was using like 6C or 30C. Yeah. But I think a lot of these studies are funded by companies like Boron, and they, even though they sell up to CM, they only believe 30C and below because of the French market. That's the way they think. So all their studies are on low potencies, and I agree. They're kind of shooting themselves in the foot without even realizing it.
And so when I do this, I will hire somebody to run the group who is of the pharma background. Obviously, they'll have to become seeped in homeopathics and homeopathic potency, and I know I'll be probably involved in this, but I will only fund research that makes sense. And Jennifer Jacobs' research is actually one of the better ones out there. We do, by the way, have also, and we talked about this last year, we have a published study that shows that 52% of people recovered 7 days faster. And this was a rhinoplasty and a blepharoplasty study. And so, and again, it's the most compelling study that's ever been done, even though it's crap it was never intended to be a study. I just needed something published, and lo and behold, the ophthalmic plastic and reconstructive surgery, they agreed to publish a study, and I was kind of shocked and certainly pleased. So, but we need to do proper research. If you want to do 1,000 studies to prove that any drug, and then the other thing they'll do is they'll do a sprain or strain, and they'll do arnica. And it's like, arnica, you need more. Or you'll do a blepharoplasty study, which is eyelid surgery. You must have ledum. Ledum in the periorbital region. Arnica doesn't work. Arnica works on soft tissue. And so there's just so many things wrong with the studies that have been done. And to do a negative study is a piece of cake, because you can either use a wrong application, wrong remedy. A sprain or strain, arnica will help some, but you need those other ones for your ligament and tendons. So arnica will work with the soft tissue, but it won't go deep into the other tendons and ligaments. And you've got to use the right application. We know that as homeopaths. And so it's about funding the research to get what we need to have done. So in the end, and this is exciting, in the end, I see that we will have this standard of care. We will understand. I right now do not know where with ligament tendons. If you look up in our pharmacopoeia, you can't tell. If you look under ligament and tendons, you have arnica, rustock, ruta, and ledum. If I have a sprained ankle, I don't know how many of them I need, and probably 700 other ones beyond that. I might only need arnica and ledum, but I don't know. And so fundamentally, we need to understand that we need to know when we use what, because they never ever, they basically, I think, just used them all at the same time, sort of like what I'm doing. And I'm sure that one or more of those remedies is not necessary. I just don't know, so I use them all. Incidentally, anybody have plantar fasciitis? Arnica and ledum works really well for that in most cases, incidentally. So just soak your feet. So, but those 4 remedies, ligament and tendon problems, most of the time they'll work. So yeah, so that basically, I'm hoping what I really wanted this presentation to do is make you realize how far we have progressed in the last 10 years. And that I see that we will make it. Does everybody get that? And any questions about like where that, the only way we make this happen is if we play by their rules and not ours. So everybody like, oh yeah, you want to sell this homeopath. I don't really want to sell it to homeopaths. I want to sell it to mainstream doctors because that's when we will become standard of care.
I have a question.
Go ahead.
Have you talked to any of these wealthy surgeons about investing into the studies or to the company, or is that too much of a conflict? But I'm sure they've got some money laying around.
So the money that I've gotten has come from plastic surgeons and derms, but there's a lot of them that are adverse to doing it. So yes, I am a connector. I'm very much thankful for what I find unique about this, I had to be not only completely technical savvy, but I also had to have incredible EQ capabilities to get these doctors behind me. Because these guys are arrogant as hell, and rightfully so, quite frankly, I suppose, just very successful and confident. If you're not able to work with them on their level, they won't give you the time of day. And so they're very much behind me, and the money that we've gotten predominantly has come from doctors, but a lot of them are just not interested in it. They just don't want to, they'll do things for free. Like Roy Geronimus, I'll tell you a story about Roy Geronimus, who again is a godfather of derm from aesthetic derm, as far as I understand. Basically, wouldn't use the product for 2 years. He's like, no way. I've used Arnica. It doesn't work very well, right? So I met with him June-ish. There's a conference in New York City. He's in New York City. I met with him, and the person I met with him got him to try it. He was so amazed. He's the one that called 40 patients, made sure they didn't bruise. He offered to do, he's a big researcher, so he'll do the study for free. Not for free, he'll do it for stock options, which obviously the only reason they're going to do stock options is if they know that this will make money for them. He wanted to be on our medical advisory board. He's on our medical advisory board. And he's like, and I'm meeting with Brent Saunders, who's the CEO of Allergan next week. I'm going to talk to him about this product. So we get that level of support from them, but he's not somebody that wants to invest. And so that's a struggle. So trust me. Back to opening doors. So my way of handling things is I open every door that is possible and 14 doors that nobody would have thought of. And it's being able to do that. And I'm really good at begging. I'm really good at being nice to people. And so I definitely will tell you there's not a rock unturned that I know of that I have not turned over.
I just had the thought that we need to get to somebody like Elon Musk and, change his life. And then he has so much money that he can just funnel it into homeopathic industry, the natural industry, everything, and really make a name for ourselves. Somebody like that, I just want to put that out there.
Yeah, what makes me sad is I won't name names, but there's a group that is in fact that way. And what they should be walking up to me, having seen what I've succeeded on with almost no money. Again, I have the strongest medical advisory board of any allopathic company out there that's under 2 billion, right? Allopathic. We're not comparing, I don't compare myself to homeopathic. I have the best business model, et cetera, like across the board. Yet this group who should be they should be walking up to me and say, with a checkbook saying, Joe, you've accomplished more than anyone ever has. I will give you whatever money. And this is what really bothered me. They're not supporting us. And it's just like you look at them and you're like, I've exceeded expectations in an allopathic world with a homeopathic product, and you are not completely like supporting me. It makes me very frustrated because I'm looking at them going, really, really, you could help me change the game, and instead I've basically got to worry about whether I can pay the bill next week. And so that don't even get me started. But you're right. It'd be lovely to have somebody who is very, well-heeled, et cetera, to do this. And, I'm just going to say, I'm just going to keep fighting the good fight, until I get there. So, but it would be lovely.
And that, I won't mention the group, but that group is a group that funds a lot of money for alternative medicine research and programs and stuff, right?
Absolutely.
Yeah.
And the bottom line is, with this stuff that I've accomplished, knowing that I've accomplished more than anyone, the fact that they're not just bending over backwards to give us whatever money they can, and the fact that they put me through hoops that were beyond belief. I finally just walked away. I said they were going to give us a little bit of money, not much. And I finally was just, forget it. It's not worth the money. You are driving me nuts. And so, yeah, no, I'm very, very, and the problem is that, guys, I'm out there in the middle of the desert completely alone. I've had to beg for money from people all over the place. And so again, the fact that these people were not like bending over backwards to give us money, and the fact that they were so difficult to work with was just depressing as all heck. So, but if you know anyone, go get Elon Musk super excited.
That's my goal.
Adrian, that was Adrian who said that, so that's going to be his role.
What I honestly believe what's going to happen, though, is I actually believe the baby company will be bought soon. I can't tell you exactly why I believe that. It's just a sense I have. And for reasons I don't really know, it seems to be me that for reasons I don't really know, I'm going to be able to do this without the involvement of all those people. I just think I'm going to pull it off. I really don't know how, but I think I am. So.
Well, that would be optimal because I think you have the vision, and any company, it's interesting, when you have the person who has the vision at the head of the company, you can do great things. When that person is gone, the company tends to falter, and when someone else takes over, it doesn't necessarily go so well. So, yeah, no, that would be fantastic, Joe. That would be fantastic.
So, everyone pray or whatever else you do, meditate to the fact that Sierra Aesthetics gets bought. Send all your good vibes, however you do them. And if that happens, hopefully for enough money, then I'm off to the races. Once that happens, and that's the entire reason why Sierra Aesthetics exists, is the little baby company, is because it was designed to be bought. And if I've got the money, we'll basically walk. And it's weird. So all of a sudden, all sorts of orthopedics people keep popping up in my life right now. I can't tell you how many, like everybody I turn around and see is involved in professional sports. It's very weird. I've like met 4 people in the last 2 months. It's very weird. So, yeah. So, any other questions?
Josephine, thank you so much for accepting our invitation, and you're doing all the right stuff, so we really wish you good luck.
Well, thank you.
Yeah, thanks, Joe.
So, do I need to give this back to you, or can you take it?
Let me see. I think I can take it.
So thank you for inviting me. I greatly appreciate it, and I'm very honored. And I just will say, don't worry, we are actually in better shape than we've been since I became a homeopath.
Well, thanks for the encouraging news. In homeopathy, we like encouraging news.
Yeah.
We encourage you. We'll definitely pray for your success.
It'll make us all, it'll make what we know and love basically shared in the end among everybody. So, okay, thank you, everyone.
Thanks, Joe.
Good luck.
Bye.
Bye-bye.
So if anybody wants to get a glass of water or go to the bathroom real fast, you can do it. We're going to go straight into my little presentation. And then after then we'll take like about a 5-10 minute snack break. And then Dr. Shepard will enlighten us on the gestalt of paragraph 153 of Hahnemann's organon, which is actually one of the best paragraphs in the whole work.
I'm going to make you organizer.
Yeah, I'm sorry, I wasn't
So you can
expecting
check,
getting off my
you can
car
check,
or-
you can make, look for questions. So you just got bumped up to staff.
Fast promotions ahead.
Oh. Okay, good.
You know, it's funny that cosmetic, aesthetic dermatologists, they love to make money, but they don't like to spend money.
It's interesting, huh? It's interesting. And it's interesting. Sometimes wealthy people are like that. They're cheapskates.
They're smart.
Abdullah and I were so frustrated with her presentation.
Who's?
Abdullah and I,
Why?
because it took her months to realize that you put the arm cream before the gel.
Isn't that
we were
brilliant though?
No, we were like, oh my God, it took you how? We were like, as soon as, well, of course you have to put the arm cream in with the water first because it needs to be able to have the water bonds. If the gel is attached to it, so you're not going to be able to activate the arm cream, and you're not going to have it weird getting it into the system. Like, I don't know, Abdullah and I are just really smart.
Hey, so what I wanted to ask Joe, but I didn't get the opportunity was, once they have the water, the aqueous arnica solution, and then they throw in the gel and make it into a gel, do they still have to succuss it again or no?
No. Remember she did the study where.
So no more succussion. So
No.
So once it's water
So she
succussed,
has
it's
the
good enough.
50 If, let's see, here's the gel, and then they put it on the face. This is the face, the nose, and the eyes. And here's the water. If you add the 50 when it's already a gel, it doesn't work.
Right.
If you add the 50 to the water before you make the gel, then it works. And if you notice, in both of them, you have nanoparticles of the arnica theoretically in both. So nanoparticles of the arnica are not the active ingredient.
So
It's got to be the water
structures
that are formed as a result of the water.
Right, it's a combination of the article with the water and being able
Right.
to have the electrophoresis of it going through the system, or else it's not going to have a transporting mechanism. And it doesn't do anything.
This is why it's so hard for someone to, like you said, whoever figures it out is going to get a Nobel Prize, but it's so difficult because it's not only chemistry, it's physics, it's material science,
Well,
biochemistry, physiology, all these things combined, water studies,
maybe I just need to work with Abdullah.
maybe.
Because we were like, oh my
It has to
God.
do with water nanostructures, it has to do with silica, it has to do with nanoparticles and starting ingredients, all those things. It's like complicated. Hey, Carmen, you get a question?
Yes, so you know how to talk about the whole paper towel technique? If you do that with other remedy, like let's say if somebody has sciatica, and the remedy like might use for that localized for faster relief.
Yeah,
Over there in the
I've not tried it. Actually, but Thomas mentioned it in the organon.
The only thing is that so if you have a skin eruption, don't put the homeopathic liquid remedy on the eruption, put it somewhere else on the body.
Okay.
But if it's internal, you don't have to worry about that. You can put it on the body.
If you think I'll give it a faster relief than you actually put the remedy in.
If it's exactly the right remedy, it's faster. And how the body can do it instantaneously when it's the right remedy, that remains to be discovered. Upon a whole bunch of sources says reactions are faster than chemistry, faster than electricity. So there's another transport system in the body. It's more or less instantaneous.
I think that'll be amazing, like for patients with arthritis and everything. So if you can do that local application, then a lot of pain installing in that one area.
Right? Or put it in the back corner.
I
So
wonder if it would work as well because if you think of what she's doing, it's more not necessarily so superficial. It's probably involving epidermis, dermis, maybe muscle.
Since it only works a certain distance.
So it stings more toward the surface. I wonder if on deeper things, how it works. But
I like to try stuff out there.
yeah, try it.
On someone.
I was fascinated to think about what she was saying about Ledum and arnica for plantar fasciitis. I think that's a cool idea. I mean, who else? I mean, everybody loves a foot bash, you know, it'd be easy to do, and you could teach them how to do it and stir it up, whatever. Has anybody tried that yet? Has it ever worked? I think it's a great idea. It's really.
How would you do that actually? Like the actual just.
Have foot bath and put arnica pellets.
Succuss it, stir it up real good.
She said put it in as the water's running.
Right. Right.
Yeah.
I think that pellets and 4 ounces of water, and you just soak the towel in there.
Yeah, that's great.
And then you just have to make sure it doesn't dry out, because if it dries out, then it's like not active anymore, so you just have to make sure
You
you
just have to be soaked in my water.
or get a new one and just put it in.
Great.
Yeah. That's great.
Yeah, your atomizer.
All right. Well, I love all this innovation. I think Josephine is kind of stimulating us to innovate. That's good. Let's see. So do I hit the arrow? How about this? I'll click here first. Okay, now it's working. Okay, good. Okay, so speaking of interesting ideas, what do you guys think of this? Now, 2 months ago, I told you about this really cool book that I found by Lipe, and I love it. It's my little go-to desk reference thing for looking up remedies when you really need to know quick materia medica. But we already talked about that 2 months ago. So after that meeting, I went online. I was Googling Lipe because Dr. Fuhr always said anything by Lipe is good. So, you know, it's worth looking at. So I found this. So I ordered it, and it took forever to come from India. So it took me about like maybe 6 weeks to get it. But anyway, this is just this little tiny book. This one here is about like this thick. So like if you look up sepia, I think there's like 6 full pages, but it's still doable. You could read it real fast and, you know, in between patients to see if you got the right remedy or whatever. But this one is even more brief. This one is like maybe a 1/4 inch thick, and each remedy has only like 1 little page, like maybe 1 paragraph or 2 paragraphs, maybe 2 if and the really wordy ones. But so basically, it's super precise. And when I was or brief, when I was looking up online, what's the idea behind this one versus the other one? Whoever was commenting said the idea of this one is you basically just want to look at, you know, 4 or 5 or 6 like super important keynotes which are very characteristic of that remedy and none other. So whereas this one, like if you're looking up sepia, they'll have like 6 pages, you know, and it'll talk about this and that and that and that, and this is like the whole picture of sepia. Whereas this is more like if you're a student and you're studying for your boards or your CHC or something like that, you know, you kind of want to see if you can kind of focus on what's really unique to the disease pattern of sepia versus other ones. If nothing else, it'll probably help you get through your test questions on materia medica. So with that in mind, I just thought I'd give you 4 examples to see if what do you think? Do you think the author nailed it? Do you think they really were able to do what they were thinking of? Because they wanted to have a little pamphlet that you could study and just with 1 or 2 key phrases say, oh, that reminds me of this. Like I always talk about Dr. Shepard when he told me a few years ago about phagopyrum, how, you know, more than just about any other remedy, it has deep-seated itching of the palms. It's so deep and so itching, and it's phagopyrum. So that was like one of the first remedies I looked up in this book, and wouldn't you know, it wasn't there. So I think we should add it because that's so characteristic. But anyway, so what remedy is this? Perspiration, which very much attracts the flies. Now, they write this in kind of like an 1800s kind of English, so, you know, it doesn't quite make as much sense as you might think, but for a dermatologist, I mean, this is like pure gold. Even if I only see 1 patient with this in my whole lifetime as a dermatologist, I mean, we see a lot of sweaty patients with hyperhidrosis, but I've never, ever had a patient say, or the wife say, oh, boy, when he starts sweating, the flies are just after him, like, you know. so this is like important for me because maybe once in my lifetime I'll see this remedy. Inclination to rest and aversion to move. So I'm thinking, kind of like bryonia or something like that, but it's not bryonia. Burning in the stomach and skin. Well, you think of like maybe sulfur has burning, hot burning, arsenicum album are chili patients who have burning. There's lots of burning remedies, but it's not that. After short sleep and after perspiring, many symptoms are relieved. So better with sweating, better with a short nap, which wouldn't be like lachesis, right? Because certain remedies are worse with a nap like lachesis. So what do you think? What is if this is like the characteristic thing of this strange remedy, what remedies come to mind? Anything? You just guess.
I found palladium.
Palladium?
K-C-A-L.
Caladium.
Caladium. Yes, that is it. That's the one. Did you know that on your own, or did you look it up?
No, I just looked up something.
That's very good. So as you're going through, very good. So as you're going through these remedies, ask yourself, so did the authors, did they nail it? I mean, this is what they want you to do. They want you to be able to read this little paragraph of like 5 or 6 little keynotes. And if one of them says, whoa, caladium, and nothing else, caladium, that's what they're trying to do with this book. I must say also, I have to tell you, it wasn't really written by Dr. Lipe, even though they aspired to him. What really happened, if you read up on this book, Dr. McFarland's father apparently was a homeopathic colleague of Dr. Lipe, and I guess they were really good in terms of corresponding. So they were like really academically like connected. When he died, Dr. Lipe died. Mrs. Lipe apparently gave a lot of his notes on Materia Medica to Dr. McFarland's son, Donald McFarland, who I guess was a younger homeopath. And so it was his idea to edit it into, he didn't want to upstage the great master's book here, but he was like, well, let's do something really, like we just said. And so that's where it's coming from. So it was actually a posthumous work. Okay, but very good, caladium. So I have caladium in my office, never used it, but now at least I know what to look for. Okay. So caladium saguinum, isn't that something?
Caladium is also good, I think, for mosquito bites, like preventing mosquito bites. I've used it sometimes. Sometimes you use ledum, but caladium can be used that way too.
Did you say preventing?
Yeah.
Oh.
People that get along.
Preventing mosquito bites, good to know. Has
It's
anybody?
It's a monograph for MMPP.
Oh, you have to share that with us someday. That's cool. Has anybody used caladium in a real patient?
Withdrawal from tobacco.
And did it work? Oh, darn. But at least the flies didn't go after him when he was withdrawing. All right. Quiz question number 2 from the Lipe posthumous book. What remedy is this? These are characteristic of this remedy. Cold sweat, principally on the forehead. Sudden sinking of strength. Continued great debility and trembling. So right now you're thinking, well, this is probably what we would call a collapse remedy, right? Numbness and tingling extremities, cold bluish skin. So it's a chilly collapse remedy. So that gives you kind of a differential of maybe 8 or 10 remedies. Generalized weakness and sudden loss of power, cold bluish skin. The pulse is thread-like and scarcely perceptible. So this is somebody that's like really sick that might be on death's doorstep, right? Intermittent fever. So in the 1800s, what disease were they talking about? Malaria. Or maybe there are other infectious diseases or whatever that had intermittent fevers. But anyway, so intermittent fever with external coldness, so very chilly, but also thirsty, much thirst. Now this is very strange or characteristic. Taste in mouth is like peppermint. So you have somebody that's like weak, cold, collapsing, ready to die, and they have a taste of peppermint in their mouth. That's most unusual. And then dangerous diarrhea. Well, in 1800s, what do they mean by dangerous diarrhea?
Cholera.
Yeah, like cholera or some type of bad disease that was making them poop their guts out, and they're about ready to die of, loss of vital fluids, etc. So, from a paragraph 153 characteristic standpoint, what remedies does this bring to mind? Of course. Now, I kind of changed things around a little bit. If you really look in the page, it said exactly this. The only thing was, to make it easy, the cold sweat, principally of the forehead, that was like way down at the bottom. But I was like, hey, this is so important, if we're really going for characteristic symptoms. So I didn't change a word. It is just that I just put that up to the top instead of at the bottom. So yes, Veratrum album, which of course Hahnemann used to like 3 main remedies he was using for cholera, right? And that was one of them. Joel remembers them all and which ones were which.
Camphor was the first stage. The chill. Cuprum for the spasmodic pain and the cramping pain. And then Veratrum was when they're collapsing. They're going to die.
So the Hahnemann's, at least back then in the 1800s, his 3 main remedies for the cholera that was going around. The first one was which one? Cuprum.
Camphor.
The first remedy as the person started getting sick, at least historically, that in the 1800s that Hahnemann used was camphor. And then as they started getting the cramping, right, then they got Cuprum was like the second phase. And if they made it through that, then the worst phase, right before they were ready to die, would have been Veratrum album. So they're really collapsing. That's just a little historical note. Okay, has anybody used Veratrum for acute diarrhea as an acute collapse? Heat stroke.
Regular medicine, they divide heat exhaustion and heat stroke as separate things, but the continuum of Veratrum can be what we call heat exhaustion.
Oh, so if they're paradoxically feeling chilly and cold, even though they're suffering from a heat-related illness, that could be your characteristic that would make you think of Veratrum album, yes? Okay.
I've seen it work in gastroenteritis even when there's not cold sweat. So cold sweat is highly characteristic. Cold sweat on the forehead, if you have it, but you can prescribe it without.
Some of these food poisoning, arsenicum, Veratrum, decide.
Oh.
Has cramps in the legs more than arsenicum. Arsenicum tends towards, sits warm drinks. Veratrum usually likes cold drinks.
They both
salt
have,
and they want ice.
they both have vomiting and diarrhea at the same time. Arsenicum, Veratrum.
So that's a great point. So for people that are still listening on the webinar, Dr. Pure is talking about gastroenteritis, acute gastroenteritis, and how we always think of arsenicum album, but to think of Veratrum album as well. So the arsenicum would be like when they're really chilly, and Veratrum would be, but they're also chilly, right? So how would you know the difference?
So Veratrum likes cold drinks.
Likes cold drinks. Okay.
Arsenicum likes warm drinks and sips.
Okay.
Both restless, both collapsed, both anxious.
Is Veratrum the more painful legs, or is that?
If they have leg cramps, then people go right to Veratrum. And sweat on the forehead, if they have cold sweat on the forehead, then you can go easily to Veratrum.
Good point.
Arsenicum also has the vomiting immediately on drinking a little bit.
All right. Oh, so for those of you who have just joined us, we're talking about this really cool little book. Actually, it's like a pamphlet. Keynotes of the Homeopathic Materia Medica by Adolf Lippe, posthumously edited by McFarland. Okay, so let's see, where were we? Oh yeah, so, of course, Veratrum album, white hellebore. Okay, next quiz question. This is a good one. And once again, the very first one here was actually down at the bottom, but I took the liberty of sticking it to the top. So this is really, really characteristic of which remedy would you think of? If the pulse is very slow, an excellent indication. This is exactly quoted from the book. I didn't change any of that. Faintest debility, so they're feeling faint. Debility with perspiration, so sweaty faintness, debilitation. Attacks of excessive debility, especially after breakfast and dinner. Feeling of weakness, emptiness or goneness in the abdomen. Dropsy. So what's dropsy for the students? What's dropsy? That's an old 1800 term for swelling, edema, like seen in congestive heart failure, pulmonary edema, stuff like that. Let's see, where are we? Cyanosis, nausea and vomiting big time. Violent and audible palpitations of the heart. So, but it's slow, like slow palpitations. Maybe irregular. Blue tongue, blue lips with a slow pulse. Who's thinking of what? Students first? Slow pulse. That's like the really big T, slow pulse, slow pulse. So like if you gave it to like if somebody had atrial fibrillation, you get the irregular pulse, but it's really fast with a rapid response, you probably wouldn't give this remedy. But if they had atrial fib with a really slow response, then you would consider this remedy. So okay, what is it? No more students? No? Okay. Oh,
Digitalis.
digitalis. Yes, exactly. So
with the cyanosis, I mean, you can think of carbo-veg, cyanosis,
Carbo-veg.
blue lips, but then you'd want to know about air, because carbo-veg always wants air, even though they're chilly, cold, they need fresh air.
So they need fans and fresh airs and stuff like that. So that's what Tim Fuhr is saying, how you would tell the difference if it's actually carbo-veg and not digitalis. So basically, and these are also another way you could think of it, these are actually proving symptoms or toxicity symptoms. Not so much now, they still use digitalis for some cardiac patients, but especially like maybe, like 10, 20, 30 years ago, there's a lot more. And then of course, a lot of times the little people would be admitted to the ER because they were puking their guts out and they were sick and everything because they were toxic. So actually they were like proving it with pharmacological doses of digitalis. And these are some of the things they would get, slow pulse, sweating, really debilitated weakness, cyanosis, nausea and vomiting, dropsy, all those kind of things. So
that's how they used to dose digitalis in the day. Before they had blood tests to determine dig levels, they used to keep giving it so the person started vomiting or started nausea, right?
Oh.
You have therapeutic dose.
Oh.
But actually, it started to be toxic, right?
That's right. Digitoxicity was a big thing because we didn't have fancy lab tests.
And what years was that?
74.
So, so Dr. Fuhr and Dr. Shepard are saying that in the mid-70s, before they had the fancy blood tests for digitalis to see if people were toxic or therapeutic. And remember, there was a very, very fine therapeutic window between killing somebody with dig and having it just right. So that's one of the dangers of the drug. But anyway, so what they're saying is in the 70s at Cook County Hospital, when Dr. Shepard was a resident, they would actually just keep giving it to them. And once they started puking their guts out and nausea and vomiting, then they knew, okay, I guess that's enough and we'll back them down a little bit. Very interesting.
It is also a good remedy for prostate, like male.
Really?
Elderly prostate problems. And interesting, Andre a few years ago presented a case of a guy who had metastatic prostate cancer, very high PSA, like over 100. And the key symptom to get to ditch was the fact that the person was very nauseous.
Oh.
And he was giving other remedies, the PSA kept going up, and after he gave ditch, the PSA started coming down.
Now, was it prostate cancer or just benign prostate problems?
No.
Or
Metastatic.
Metastatic prostate.
Stage
Really?
But the key was prostate and nausea.
Ah. So Tim relaying a case, successful case by Andre Sane, where he had metastatic prostate cancer, which was metastatic, and he was so nauseous, and it just turned out that dig was the thing that saved him. So that was the keynote, was the nausea.
Well, I don't know what eventually happened to the patient, but his PSA had been going up, trying different things, different remedies, and only after the dig, the nausea got better and the PSA started coming down.
That's very interesting.
Yeah.
Okay, last. Oh, who else has used digitalis successfully on patients?
A case where an elderly man had glaucoma using a beta blocker eye drop, and he would pass out.
Oh.
So I said, okay, let's do it on the office. So I got that scope and put the eye drops in, and his heart rate went down, and he passed out. So I ran to the pharmacy group and got digitalis. If it didn't work, I was going to call 911, and it revived him. So to me, it's a potential to undo the side effects of beta blocker.
So basically, so if the proving symptom of the beta blocker was slowing down the pulse, and since that's the characteristic of digitalis, so that's how Dr. Shepard thought of giving somebody digitalis, because he was getting bradycardic and passing out from eye drops. He was very sensitive to absorption of the beta blockers. Very interesting. Wow. So like if you had a congestive heart failure patient, and let's say you've tried all the things that you normally use, and even ammonium carbonicum isn't working, but if the person has a really slow heart rate as well as has the congestive heart failure and AFib, but if it's very slow, and nausea, and swelling and all these other things, then maybe you could think of digitalis, homeopathically, of course.
Yes, I have used it in congestive heart failure.
Very good.
And it has another unusual symptom which you keep waiting for, blue vision.
So color changes in vision. So how is it like a TV screen that was just too blue? Is everything blue or just certain things?
Everything has blue in the background. Blue vision.
So doctor, yeah, I didn't mention that. That's a very good point. So it's blue. I knew it was color change, but I didn't know it was blue. So like when you guys would put people on that in the hospital in the 70s, was that one of the things they said, everything looks blue? Isn't that interesting? Well, that's how you can remember, like they have blue lips and blue skin, but also blue vision. So color changes as a proving symptom of digitalis. Very interesting. Last quiz question. Okay, what remedy does this conjure to mind that's so characteristic? Want of sensation of the whole body. Okay, now this is 1800s. We don't say, well, I'm complaining of want of sensation. What are they saying? They don't what? Not really. Want of sensation. Want means lack of. I don't have sensation of my body. I can't feel things. I'm insensate. Painlessness with most all ailments. A lot of ailments have pain, right? Like many things when you're sick are painful, but they're saying these people are painless, even with most diseases. Fecal constipation. That's kind of, what is fecal constipation? So like, I'm sorry, fecal vomiting. What is fecal vomiting?
Obstruction.
So like if you have an obstruction, so basically you're vomiting, instead of smelling like something you just ate, it's smelling like from the other end. That's highly unusual. So this would be characteristic. It makes me think of the remedy. What was the nice remedy that Dr. Fiora told us about a couple years ago? He brought it in and he didn't even open the remedy. It smelled like terrible. Asafoetida. So, I mean, they have like the flatulent hysteria, like the reverse peristalsis. That was such a great lecture that you gave. So I was thinking of that, but I'll give you a clue. That's not it. Constipation is like a really big characteristic of this remedy. Of marked usefulness in states of stupor. What does that mean? That's 1800s way of saying what? For people that are really out of it, people are stuporous. They're like maybe if they were in a stroke or something. Or full and slow pulse. So we just talked about slow pulse with the last remedy, right? But this is a full. What does a full mean as opposed to like bounding with belladonna? What's full? What does that mean? I'm asking because I don't know. I mean,
bounding instead of thready.
So it's not thready, but what's the difference between full and bounding? So maybe it's not as intense as bounding is like boom, boom. So maybe it's like it's there, it's not thready, but it's not as much as. Is that true?
It has a complete, the bounding would be even more.
Okay.
Yeah.
So full and slow pulse. Sensation of labor pains with snoring, stupor, and twitchings. So what are they saying? What are labor pains feeling like? Well, labor, like you're having a baby, right? So like contractions, like abdominal contractions, right? With snoring, so your patient is kind of out of it. They're stuporous, they're snoring. Maybe they had a stroke, maybe a drug overdose. And twitching, what's twitching? Well, muscular twitching, right? And then also paralysis of lungs. Well, in the 1800s, what does that mean? We don't say, oh, I just admitted a patient in the ER with paralysis of the lungs. Well, what would you really say? Respiratory arrest. You just had to intubate them, right? They're on a machine and they can't breathe. They're paralyzed, right? So respiratory failure, right? So what is this characteristic of? First, we ask the students, because this is such a good one. Burrita carbonicum. Very good thought. No, but that's a good thought. But it doesn't cost anything to guess or to give thoughts.
Try another one.
Try another one. Look at.
We did a case like this in class. We did a case like this in class.
This is really important.
We did this in class. This case like this in class.
And you have to think fast because your patient's in your office. He's stuporous. He's in respiratory. He can't breathe. And what's happening is your medical student is giving, like artificial respiration, almost CPR, but they're giving rescue breaths. And you're like, wait a minute, give me a couple minutes. Let me look through. I'm sure you're medical.
The remedy, the patient is dying, basically.
No.
Very good thought. Opium. Give that girl a Heineken. Opium. Yes. So very, very good.
You think of opiates. What do opiates do? It gets rid of pain.
Yeah.
You get constipated. It's crazy.
This is what happens when the.
Good work.
Delirious, stupor, snoring.
This is what happens when people get their morphine.
Right. How did Prince die?
Stop breathing, they die.
How did Prince die? How did everybody that dies from opiates? Well, first of all, they have constipation, all that other stuff. But eventually, they just stop breathing. I mean, but they're not in pain. They're just kind of stuporous. They just all of a sudden, it's very subtle. They just stop breathing, and then you call a code.
And the interesting thing, when the first responders, when they respond to people with opiate overdoses, one of the biggest things that happens is they give them the Narcan, they start breathing again, and then they get angry and they want to hit the person.
Yeah.
They're like, oh, I felt so good.
Yeah.
Like, you were dead. You
Oh,
were,
yeah.
like, you were there. You were going to die.
Yeah.
It's very difficult for the first responders.
Oh, yeah.
It has saved your life. Why do you want to hit
Before I give him this, hold him down.
me? Exactly.
So very, very, very good. Opium, poppy, watch of sensation. So insensate. Yeah. Very.
Well,
Dude,
you could use this for people who are dissociated.
what?
It's very good. It's very good remedy for, and I think you can case or two of ailments from fright, where someone is in a situation where there's big fright,
Intense.
and then just freeze.
Oh.
And they're just dull and numb. They might not have these, but it's like that kind of state. So ailments from fright.
So ailments from fright, and maybe you've tried aconite, because everybody knows if in fright, give aconite, right, as a student. Well, but maybe you gave aconite and it doesn't work. Well, what's your next? So now we have like another something to think of. Tim says, think of opium.
Is that a case of-
Okay, so maybe I could present
You want to give us a preview? Okay, fair enough.
It's an incentive.
You got to keep a little back.
Okay, so anyway, that's the last one of that. But let me just say that. So what do you think? Thumbs up or thumbs down? Is it worth $13 from India? It took 6 weeks, but I give a thumbs up. Hey, even if it only helps you with one remedy in your life, one caladium patient, it's worth the $13, and that's including shipping and everything. Okay, another interesting idea. So here's the thing. So like I'm in my office and I get some of these free magazines, just like you all do, and I'm not a businessman. So, but anyway, I get this. So I get this magazine. It's Fortune magazine. And I'm like, I'm kind of bored, and I'm writing out payroll checks. I'm like, I need a break. So I don't know anything about artificial intelligence. So I've heard about the medical students at Loyola and the residents are always talking about AI. It's the big thing in dermatology. It's the big thing in everything. We got to know about it. Blah blah blah. And so I'm like, oh, maybe I should read something. So I'm reading it, and so it says 25 ways AI is changing business. So I'm thinking, wait a minute. I mean, we're important too in homeopathy. We must have at least 25 ways AI is going to change what we do for the better of us or our patients or whatever. How come, what's going on? So it's like, look what it says here. Like, how is it going to help medicine, or how's it going to help business? Helping your customers, hiring smarter, finding blockbuster drugs for medicine research, fighting the next war. That's kind of scary. Getting your next promotion, translating your voice, so stuff like that. So is there anybody, before you guys went into medicine, is anybody that has like a computer science degree? Is anybody that's worked on research for AI or anything like that? Because I don't have any experience with it. So I'm just thinking, so what are the implications for homeopathy? I mean, if it's gonna change, if it's gonna turn business on its head, I mean, it's gotta be doing something for us. We're using it right now, like in my old Radar 10, we have the Vathulkas expert system. And from what I understand, I think that's one of the kind of early AI things. But I mean, like right now, I mean, my wife, she says, okay, Google, where's a good sushi restaurant? And there it is. Well, that's AI, right? There's voice recognition and stuff like that. What are we going to use it for? And what do you guys think? I mean, I could see where on your smart, because right now for $99, you can get the Radar Opus app for your smartphone, and for $99, you can type in there kind of a limited repetitorization. So like if you're on vacation and somebody has like a sore throat, you could kind of do what we do now with our laptops, but it's not vocal. I mean, wouldn't it be nice if you said, okay, Google Homeo, okay, my wife has a fever and it's 2 in the morning and she's chilly and she's worse after midnight, she's having respiratory problems. List all the flu remedies that I could give her. And you know, wouldn't that be nice? I mean, is anybody working on that yet? I mean, it seems like, you got Cortana, you've got.
Like ABC Homeopathy will go and put in their own symptoms and things like that. But it's a lot of it is garbage in, garbage out. You have to take a case to really get the important symptoms.
Yes.
I don't know, so it's not really, it's more like a comment, because like when I've been repertorizing, it could be just the one time thing, but it'll kind of tell you like where to actually go, but instead of like clicking on that link, it doesn't have a link to like take you to that portion. And so even we were talking about that the other day when we were working on our last case, so it'd be great to have a more web-like, and I think it's something that would be more beneficial, because like having even if you just give them, you can have the 100 symptoms, but if they're not rating the 3s, 4s, and they're all kind of mixed up, I don't think that's going to be as helpful with finding the remedies. I think it's more so just the efficiency of like a web-like find throughout the repertoire organization process. I think if anything, but that's just my personal opinion.
The other thing that the dermatology residents are kind of worried about, because everybody's like, oh, AI is going to be so good. Look what we can do with, Cortana and Google, Ask Google and stuff like that. But one of the residents, he's like a second year, and he was saying, yeah, but if the computers are getting better than, for finding melanomas than us, then maybe they won't need dermatologists. Maybe it's going to get us out of a job. Maybe they'll have, mid-level practitioners with their little device that goes right on the skin lesion and it analyzes it and it says, yes, refer to plastic surgery, or no, just watch it, So AI has its yin and its yang. It can be good for people, but remember, computers put a lot of people out of business too. So the question is, how will it affect us? Will it even, will it get so good? Or maybe people, homeopathy is such a small piece of the pie, maybe they won't be using it. I do know, I Googled homeopathy and AI, and there were 2 really good research papers came up, and both of them are from India, because aren't there more homeopaths in India than any other country in the world by number? So there were 2 really good research papers, and they actually said this is like the state of the art with AI and homeopathy. And they both referred to something called fuzzy research, or fuzzy something or other. And that was like the model that they use on computers to use for problem solving in homeopathy. I'm not sure what that fuzzy theory is, something like that. Yeah, that's what it is, yeah.
Well, the problem is in homeopathy, the same input, you have to have multiple answers. Good. Web-like results with artificial intelligence, and for the most part, there's one input, one output.
Yeah. But maybe in the future, if we get better at it. So anyway, so I was just thinking, so how is AI, well, first of all, will it even help us? Hopefully it will. There are some of the brilliant people in India are working on it right now. Will it do our repertorization faster for us with greater certainty? That's what I would hope for. What are the things we don't like about, we all love homeopathy. What are the things we hate about homeopathy? Well, if you have like 50 people in your waiting room, you can't do a 2-hour repetitorization on every single one and still get out by 5 o'clock to see your family for dinner. It's just not going to happen. So it would be nice to speed things up, make it, get to the root of the characteristics and stuff. I don't know. Waste rate is in software perhaps. But the main question is, so Hahnemann the master, he was a genius. He was like a thought leader. He was one of the intelligentsia of his time. If you're alive today, what would he be saying about it? That's what we should ask ourselves. What do you think? He wouldn't be a Luddite. I don't think he would say, well, let's not use computers, right? He was like one of the brilliant guys of his century. What would he say?
He encouraged people, Benninghausen, to make a repertory, and then he came up with a therapeutic pocketbook with kind of a condensed repertory and publish it. I think he embraced the technology of the day, so
I think so too.
As long as it's used in the right way and with the knowledge of how homeopathy works,
right?
And trying to
7 per minute, slow burn, bounding, cold. Those are all the data terms. Even under fever, we don't have any numbers. Fever chapter, those are all qualitative. So the AI research is not very qualitative.
Oh.
So it's hard to say how it can be applied. The reason why I can't take out.
So for people listening, Dr. Shepard was saying that when it comes to either qualitative or quantitative things, the field of homeopathy that we're in is mainly qualitative. So instead of saying the pulse is exactly 57, it's slow and thready, so it's qualitative. So for right now, one of the main issues is that AI is mainly quantitative and not qualitative. But, you know, I mean, it's moving so fast that who knows, in 5 or 10, 20 years, maybe that won't be an issue.
I think from my perspective, like I haven't taken a case, I've never used a repertory yet. I've just been learning about the idea of homeopathy. So to me, this makes a lot of sense because it's whatever can make it easier for people to practice.
Mm-hmm.
And if, you know, if it gets more people interested, if it gets people to look into it more mainstream, I think bridging that connection between, like Joe's doing, I think that's really awesome. And this kind of is in line with that. This makes a lot of sense. I feel like from my point of view, the repertory and all that, it needs to be sped up and kind of brought to today's times. And this is maybe the way. I don't know. Because I haven't done it yet, so it's hard to say.
Last question is, you know how like on my Radar 10, the old version, they have the little, you click on it, it says Vathulkas Expert System, and it says this is based on his way of thinking, consider arsenicum or consider this remedy. But now he has this new thing, the Vathulkas, I don't know what it is, you can have like an online subscription and it helps you that way. Is that AI that he's using, or is it just like a computer repertorization system? Does anybody? Yeah.
It's
So what's up with that?
Repertory. It's a subscription, so you have to pay every month or you can lose your subscription. And what they're doing with it is, it's his repertory with additions, like Kent's repertory with additions from him. And Materia Medica's there too, so you can look up Materia Medica. And then what they're doing is, because people have to put their cases online, they're collecting data from, oh, you had a successful case of pleuritis or pneumonia, and what were the common remedies you used? So they're like, and what were the rubrics that led you there? So they're doing research on which are the most important rubrics. Some rubrics are more important than others. Some rubrics you look at and you don't often confirm they're useful for finding a remedy. Other rubrics we use all the time. So it's like confirming, like, these are the important rubrics. You have a condition like this, these are the things you need to look at.
So would that research be considered AI or not? If, depending on how they put it together?
Well, they're using computer technology to take data from lots of cases to try and see what's useful for predicting, you know, so in some sense, yeah.
Huh.
It's kind of like what you said when you talked about the gentleman has a book on rust pox, rust poisoning.
Oh yeah.
And he said one of the most important questions you can ask Kreisberg is it better with warmth or not? And that is, you go this way or this way in terms of remedies.
So that's kind of what Compass is doing.
This is, if you have a clinical situation like this, you go, and it's similar to the CETH course. They do clinical homeopathy. They don't use a repertory. They just go from, oh, you have a clinical situation, you have people with dysmenorrhea. These are the questions you need to ask, and that will be, if they bend double, you think of these remedies. If they don't bend double, you think of these. If they're better with warmth, you think of this. You know?
So like an algorithmic type of thinking, yeah.
Exactly.
Oh.
Maybe it puts together algorithms.
Yeah, yeah.
I mean, doing what we do, algorithms don't work because, you know, the patients we see tend to be very complicated on lots of stuff. But in a clinical setting, a primary care setting, it could be used.
Any other comments on AI before we move to the last little thing here?
So that's what Red Medicine is doing, is big data. Gather every database, like everyone with prostate cancer has to be in the database and figure out what works the best. That's to me is data, not exactly AI.
Okay. The last thing is, I just had a case a couple of weeks ago that didn't actually come in for homeopathy. It was actually just a regular dermatology second opinion. And I just wanted to tell you right up at the top that I don't have any follow-up data yet. I'm just asking what I want to know, and I'm asking you this not because I'm quizzing you, but I want you to know, or I want to see if you know, do patients with this rare skin disease, has anybody ever had experience with it, and do they respond to remedies at all or not? Now, I can't really show the picture for the recording, but why don't you gather around here and take a look here. This is what she looks like. Can everybody see that? You want to get up closer? Very disfiguring annular kind of flat back with very little of no scale. But the most important thing is that she has really erythematous to brownish plaques. Everybody has rashes with redness. This is a really weird brown discoloration. And that's like the key to the diagnosis for this condition, which is really rare. It's the first time I've seen in like 26 years. Now, if you're looking at this white patch, what that is it's such a hard thing to get rid of that she went to a plastic surgeon, did the best that they could, and they cut a whole chunk of it out and put a skin graft. So,
Because that's not part of the disease.
so the white thing is not part of the disease. That's just kind of a funny looking, but that's the way it looks when you have skin graft. But it's a good result for a skin graft, but it's not big. You can see some well-healed linear scars because the other dermatologist from the university was cutting out some of them as well, which there's no cure for this condition. So all they can do is either cut it out, and that's about it. So so she comes in to me for a second opinion. She was worked up. I didn't diagnose it, but she was diagnosed at the big university in the Illinois area, and so basically it's not itchy. Annular reddish brown, that's like the key. It's not itchy. So what does it feel like? Well, it doesn't really feel like anything, but every now and then it feels kind of irritated, kind of like if you had like too dry skin, chapped skin. It feels like, ooh, it kind of stings, but not real symptom. Lot of symptomatology.
Did you ask her what happened 12 and a half years ago?
You're thinking like a homeopath. I like that. I did. And sometimes that's the only thing we can do. Sometimes you see people like Tim sees people that have been to all these universities in the Mayo Clinic, and as the last, effort, they come to see us. So same. That's what gives us a really, really great tool.
Well, I get that, but it just, my brain doesn't work like that.
Well, that's why we have, this field. It's on her bilateral cheeks. It's getting worse. She's been on dapsone, 100 milligrams a day. Actually, that's like the main drug for dermatitis herpetiformis, but that's not what she has. That's a real itchy disease. This isn't itchy. She's had lots of injection of steroids, surgical excisions. The bottom line is this condition is extremely hard to treat. It doesn't kill you. It's not cancerous, but it just doesn't go away. It just doesn't go. It just stays there and gets worse and worse, and eventually you die from something else. And it's very disfiguring, and that's why she's so depressed emotionally. So the question is, what do you think it is? And then you could. I'm going to ask you, have you ever seen anybody with that? And have your remedies helped or not? Because I looked it up and I didn't see anything. Usually I look into homeopathy and cured cases and stuff like that. I didn't see anything. So what's our differential diagnosis? Well, it's on a sun-exposed area, so you think it may be lupus. Lupus has annular ring-like plaques from the sun-exposed areas. It's hard to treat, but that usually gets better with intralesional steroids. So it isn't that, but that would be like the first thing I would think of. The other thing I would think of is if they just came from India or Mexico or somewhere where they have a lot of leprosy, I'd think of Hansen's disease or leprosy. I had one case of that. It can look exactly like this, leptomatous leprosy, but it isn't that. What else can look like that? Granuloma annulare, which usually is more pebbly and bumpy, but it can look very annular like that. Even
is that usually on the face, or
I've never seen granuloma annulare on the face, but I suppose it could happen, and it would look kind of like that. I mean, nummular eczema could look like that, but mainly lupus would be more common. If the person's coughing, if their ACE levels of their blood are high and they're being seen, they're on prednisone from a pulmonologist, you think of if they have angiotensin converting enzyme levels are very high. They have lots of lesions on the X-rays, and they have dyspnea, and the pulmonologists are treating them for pulmonary It's not tuberculosis, sarcoidosis. Sarcoidosis can look exactly like this of the skin, but it's not any of those things. Like I say, I didn't diagnose it, but they did the biopsy. The biopsy showed granulomas, which is like really deep inflammation in the dermis, and also a mixed infiltrate, but characteristically it has eosinophils in it. So that's kind of weird. This is kind of an unusual thing. The eosinophils are usually seen in allergic reactions. So any guesses? So what she has is this condition called granuloma faciale. So it's not granuloma annulare. It's almost always just on the face. It's very rare. Like I say, it's the only case I've ever seen, except when you go to big meetings and they show cases like this. It's usually middle-aged white men, but anybody, any race, any age has been diagnosed. Usually asymptomatic, but sometimes they say, well, it kind of stings, it's a little irritated, but it doesn't really, itch that much usually. The trouble is there's no really good treatment for it. So that's always a good reason to try homeopathy when nothing else is known to help it. The only thing is, like Tim always said, how do you know if homeopathy is going to work for something? Well, if the body has a mechanism to cure itself, if they can go into spontaneous resolution, like acne, like eczema, all those things, as you get older, sometimes you kind of burn out and it gets better. Even having herpes simplex, as you get older, sometimes it gets less and less until you don't have it anymore. So obviously those things respond very well to the right constitutional homeopathic remedy because the body has a way of healing it and spontaneously resolving it. There have been maybe a few cases where it's gone away, but that's usually not the general rule. So,
so it is possible. There are cases where it goes away.
There was one study a long time ago, and they said, it was kind of conflicting. It said nobody had spontaneous resolution, but then at the end of the article it said this one person, as the person got really older, the disease went away. So it kind of did have a spontaneous, but I don't know if that was one of the ones that was treated or one of the ones that wasn't. But anyway, so maybe it's possible. So has anybody ever gotten hit with a granuloma faciale case in your homeopathy practice, and did it help or not?
Well, we've seen one case in 26 years, and you only see skin cases. You've seen hundreds of thousands of skin cases. We see a lot of people that come with a lot of other conditions that happen to have skin problems, but you have the experience.
I figured maybe somebody from the Mayo Clinic may have gotten on a jet and come to see you.
No, they probably come to see you, not me.
So anyway, so here's the thing. So as you were saying, so the first thing you're just dying to ask this patient is, so she said everything was just fine until I think it was like 12 years ago. I'm like, well, what happened in your life 12 years or 13 years ago? And she said, oh, nothing, But all through the whole conversation, she's always saying about, how abusive her dad was and how she was always angry but never really could do anything about it. And all through her life, I just kind of talking to her, she's had all these abusive partners, most of them are violent. Finally, she's with a guy that isn't violent. He's maybe has some issues, but at least he's sort of a nice guy. But so 12 years ago, I said, so what was going on? This was like the worst breakup she ever had. I mean, this guy was going to kill her and her kid. I mean, it was bad. So I said, how'd you react? And well, of course, when you have somebody who's bigger and stronger than you, that's about ready to kill you, you're not really going to maybe fight back. But she said, well, this is what she said. I didn't say anything. I didn't say much, but I tried to calm him down. And then afterwards, I just removed myself and my son from the situation as fast as I can, right? I mean, we would all probably do the same thing. But I said, but the main thing is, so how did you feel? What did you do with it after you removed yourself from the situation? She was like, oh, I was just so angry. What did you do? Well, I told my friends and mother. And I said, well, what else did you do? Well, sometimes when I'm really angry, sometimes I'll throw something at work or maybe I'll swear, but for the most part, I just kind of stuff it inside was basically your answer. So the cool thing about homeopathy is, first of all, I mean, she didn't even come in for homeopathy. I said, the treatment you got at blah, blah, blah university was excellent from a conventional dermatology standpoint. I said, there's very little I could add. Yes, there's a few other drugs you haven't been on yet, but I mean, I don't think they're going to work any better than the high-powered stuff you've already had. So I said, from a conventional standpoint, these guys are doing a great job. I think you should go back to the actual dermatological care. And, even though it's a very difficult thing, and they still might not be able to help you. So I said, nothing else I can add from a conventional standpoint. But there's only one thing I do that they don't do, and that's homeopathic medicine. So I said, and it just so happens that we have medicines that are really good for suppressed anger. and things like that. So I said, well, what do you think? I mean, no, I'm not going to force you. And she said, yeah, I'll try it. So I just gave it to her 2 weeks ago. And
You should have said, what would you have given her?
well, you know what I'm going to give her.
We're already.
You already know.
No.
Now, of course, what else would you be thinking of? Well, maybe causticum, you'd have to really get into it. What are you angry at? Are you angry because it wasn't fair? It wasn't just, or, what? But so it could be. It could be. But there was no way she was going to come back for a 2-hour visit. I couldn't do it the right way and ask her a million questions. It was either I had like 1 minute to decide. And I was like, well, so far I've had 3 people where their derm things have gotten so much better with Staph aureus, only because it happened right after, never been well since, a suppressed anger. So that's what I gave her. What would you guys have given her, given that limited lack of homeopathic knowledge? And she says, I'm not coming back. I'm not going to do a 2-hour. Either give it to me or don't. What would you have guessed?
Well, no, I would recognize the treatment, location.
Face?
function,
Face?
color, reddish brown,
Oh.
and shape. The word annular is not in the repertory, but the word cercinate.
Cercinate. Oh.
Before just prescribing animal.
So cercinate. So cercinate, face, and suppressed anger, or ailments from suppressed anger.
Yeah. There's a lot of
So does anybody have the repertory open? Can you look that up?
and the discoloration of it.
So brownish.
Reddish brown, which is the sepia color.
So brownish red, skin discoloration, and then ailments from suppressed anger and eruptions, face. Oh, is it yours? Yeah.
Let's do it here. So what do we got? So eruptions on the face.
Oftentimes,
Do you want to say anything specific? Eruptions on the face? Do they have cercinate?
If they have cercinate.
Nope. Reddish.
so there's coppery.
Oh, coppery, yes.
Coppery? There's coppery?
So coppery is sort of like a brownish red, kind of.
You want to do general eruptions face too? General eruptions face?
I don't have any idea.
So we'll do coppery. We'll do general eruptions on the face.
They don't have ring-like, do they, or ring shaped?
That cercinate, I don't remember if it's under the skin or if it's under face.
Cercinate would be under skin. Ring, herpes cercinus, that's under cercinatus, tonsillus. I'm not sure what that means.
That means there's hair loss. So like a cercinate hair loss.
But here it's cercinate. Do you want to include that or not?
But that's for hair loss.
Okay, so not include that?
Yeah, no.
And skin eruptions, herpes cercinate, so we want to do that. Eruptions, herpes, cercinate.
Thanks, Dr. Shepard. That's very helpful.
So, question that when you said repetiform, that was one of the differentials. What makes it repetiform?
Well, what they thought was herpetiform in the 1800s versus what we would think now are probably 2 different things.
Yeah. Why did you say though that was one of the possible diagnoses that makes it repetiform in modern times?
Oh, I never said it looked. I never said it looked like herpes.
You said some kind of a correlation with.
Oh, I think what it was is the type of conditions that we treat are ones that spontaneously get better with time, such as herpes, such as eczema, such as, but no, this doesn't have anything with herpes.
And so for the reddish brown, one of the ones you said was reddish brown.
So brown.
It's interesting. We got brown red here, nitric acid. And that's from Hahnemann. From Hahnemann.
That's why not the emotion, being that that's what caused the outbreak.
Well, just look at how many remedies are for anger.
We'll get to the emotions. We're going to include that too. I just haven't gotten there yet. And then we have brown and brownish red.
Yes.
We want to include both?
Sure.
Yeah.
But see, Dr. Shepard's point is very good, and that is, you know,
Oh, here, brownish red. There's
everything that
another.
has suppressed anger isn't Staph aureus. I mean, there's a whole bunch of them. So his point is, well, let's be a little bit more, you know, let's put in the brown and the face distribution, and that's a great idea.
Here's probably a good one under red. It's brownish red.
Brownish red.
And you've got
Like you
carboveg,
said,
nitric acid,
sepia.
phosphorus, sepia, thuya.
Right. And then the kicker will be, let's look up ailments from grief, and which of those would also be found in those same other rubrics.
So brownish red. Ailments from,
And then.
but we had, like Nisi said, we have suppressed anger. Suppressed anger, right?
But would you put it fear? Because the dad was very abusive, the guys, and she like hurried up and everyone to leave. Get out of there, like how much of that is associated with fear?
Well, it would be, but the overriding emotion,
Right,
I
her
think,
emotion is
was
suppressed
more angry after the fact, like a suppressed anger. But I'm sure there was fear, of course.
So we have, I put under anger suppressed, we have disappointed love. That'd be like a broken relationship.
Well, she was not grieving at all. She was happy to get out with her life. So I don't think I would put that down.
So not disappointed love.
No,
So anger suppressed, we got that.
totally. And ailments from anger, or maybe ailments from suppressed anger. Yeah.
I have suppressed anger.
That's good. So maybe Dr. Shepard is right. Maybe sepia could have been a better choice.
And so we got the cercinate, we got the reddish brown, and let me combine these. Should I combine brown,
Yeah.
reddish brown?
Right. Yeah. Yeah.
Well, at least,
Yes.
You do that as a common remedy. Oftentimes it'd be separate.
Okay.
Those smaller remedies.
Okay. Maybe I'll combine these two, the brownish red. I'll just combine those two. It only adds one remedy. Well, and actually the same remedy. I don't think it's going to add
I'm
anything.
not sure, but I think she had numerous cavities, numerous
Yeah, that's
caries. I think.
So we got the brown, we got the brownish red, we got the face and coppery, and we have the suppressed anger. Anything else?
No, it makes the copper with the brown and red spots.
I can maybe combine these two.
And I think she had increased dental caries. I think. I can't remember.
Face, erupt, coppery, skin brown, spots. And caries?
Or numerous cavities
So
at an
caries.
early age. So how would you say that?
Caries.
Teeth, caries.
Caries. Yeah, caries. I include that. Yeah, that's same.
If you look under, I did a search for Staph aureus, looking at your face. When you're looking at face eruptions, the text-based discoloration around it.
Repeat that timeline.
It's specifically an eruption. You have to do the color of eruption.
You did a reference work search?
I did a search under remedies and words. So I looked up Staph aureus to see what kind of eruptions Staph aureus might have on the face with a brownish red.
Mm-hmm.
It says face discoloration brownish red. It doesn't say eruption.
Repeat that timeline.
It has blotches.
She looked did a search in the repertory under Staph aureus and then under eruptions, and she found face brown red.
Brownish red specifically.
So it's interesting. Staph aureus here doesn't have the brownish red, suppressed eruptions, doesn't have the face eruption coppery brown spots, has the caries, of course. Yeah, looking at it repertory, I think you'd look more at sepia, phosphorus,
So this is
maybe nitric acid.
from my standpoint as a clinician who's never treated granuloma faciale with homeopathic remedies, Dr. Shepard's and Dr. Fiore's and all your comments are extremely helpful for me. I mean, because especially when you're kind of winging it and you're only using like maybe three symptoms or whatever. So this is extremely helpful. So thank
I'll
you.
make a copy of this and send it to
Yeah,
you.
that's-
So you
Good
gave her the
screenshot.
Staphysagra 30-day.
What?
You gave her the Staphysagra 30-day.
Yeah, and I said, take it only on your next day off. Take it
Right when your boyfriend's not home. I saw that. And then if it's not the right one, it'll point to the better one.
Yeah, sure.
And you have to see how the sensitivity is. If she doesn't have any reaction, just push it a little bit. Go with once a day.
She's
Take it once a
gonna,
day for a while. If any aggravation stops.
she will, right.
Yeah.
Well, good, thank you. Now I have something to take back and see if it'll help her. So, that's it. Yes, Francine, oh, questions?
Just as a question, you might ask somebody, since, you know, since maybe it's constitutional, but you don't know, or could you say to somebody like that, that since the situation happened with, you know, when you had this anger in the situation, did anything of that change? Like the body temperature, your liking the sun, or cravings for food, something other than what was obvious on her face? Something about her change.
It's a good point. If I ever see her again, I'll definitely ask her, did anything change after the breakup? Is that what you're saying? Yes,
People tell you so many things.
yes.
Oh, I used to always sleep on this side, now I always sleep on that side. But it may be useful.
Very good point. There was another comment?
So you give her 2 pods a week, and go how long?
Well, she's just gonna do it. I said, just try it and see what happens. If it's a terrible aggravation, don't do any more. Just wait. If nothing aggravates, if the skin aggravates a little, that's a great symptom, sign. But if she's doing fine, I said, well, heck, at least do it maybe every time you have those 2 days off, because I think she gets like Tuesday and Wednesday off from the hamburger place she works at. And then if it starts getting a little better, then that's fine. If it kind of stops, then we'll go a little more frequently. She could even go to every day or twice a day if she needs to.
With the drug she took, did anything change? I mean, she just took the drug, the Dapsone. It's a pretty strong drug, right? And
The only thing that worked the best was the surgical excision, but you can't really cut everything off, So, no. Well, basically, she thinks that being on Dapsone and the intralesional steroids, she thinks it's keeping it a little bit in check. But the point is, it's actually still getting worse and getting bigger and getting new lesions. So the whole reason she's here for a second opinion is she doesn't really think it's well controlled and nothing really is working that well. So
my sense is you're gonna have to push. The remedy's gonna work. It's like an incurable condition.
And
You're gonna have to
it's very
push. You're gonna have to push the remedy, maybe push the potency, push the frequency.
So
That's my sense.
don't be afraid to really push it.
Don't be scared about it, just do it. But maybe have her put it in water.
Yeah,
Oh, you could have her put it in compresses.
maybe. You never know. Yes.
What I was going to say, that we just do the steady because you wanted to play safe. Somebody would have, I would have wanted to see.
Yeah.
And then one end they don't know.
Well, just as an aside, when I didn't know anything about homeopathy about 10 years ago, I thought when I was just starting out, I thought my wife needed Staphysagra. So I just gave it to her and she was taking a lot of it. And oh my goodness, I've never seen her so mad. I thought I was going to die that weekend. And I thought she was going to kill me. And it didn't make anything better. So obviously she was just proving it and it wasn't the right remedy. But then I realized, don't just go, whole hog. Just give her one and see what happens. It's the Dr. Fiore and Shepherd approach. Just see what happens. You could always make it stronger. You could always make it faster, So in the interest of time, let's kind of have our snack break as Dr. Shepherd is starting his lecture. So we'll start right away. And I'll just get the snacks and pass them around.
Okay.
Thank you so much for those.
Any
Those were
questions?
really helpful.
You're welcome.
Sorry, we were running a little late. We tried to get the door for about an hour and a half.
Yeah, when you text someone, I'm like, oh, I should be used to it. And then,
You kind of walked in with a flourish with kids. That's cool.
But a different guy. Oh. Yeah. Yeah.
She's doing stuff though.
And,
Yeah.
you care about money, I usually care about money.
Yeah.
So, I mean, I push more than they're doing shit, but they don't.
Which one? Gestalt.
What's the intention? Yeah.
Gestalt.
Yeah.
They think they get it, they see that much money, they can push and they make waves, which is fine.
Right.
To push and make waves, but if
Yeah.
you don't have that sensibility behind it, passion
Yeah.
behind it, you're just.
So forward and back, forward and back.
Yeah.
Takes a lot of dollars.
Yeah, that's so I was making like together.
Okay, I'll start. This is a talk that comes from a request from the new editor of the American Journal of Homeopathic Medicine. He requested that I talk about paragraph or aphorism 153. He didn't say why, but I agree because it is an important paragraph in the homeopathic methodology. So I wrote an article for the journal. It's about 1,000 words. It'll come out in spring, short for people's attention span. And this is a kind of a lecture version of that same material. So like in the article, we put keywords at the beginning. These are some of the words that we're going to discuss to understand that aphorism better. You know, in the structure of the organon, the first part is experiments, observations, experiences, makes conclusions. From the conclusions, we have our principles. And then the second part of the organon, starting, if you are studying homeopathy 1 and 2 classes, starting with unit 7, is the practical part. So unit 7, practical part is how do you take a case? Aphorisms 82 to 104. Then how to know materia medica by doing provings. And after that, aphorism 153 is in the next unit. Once you know the symptoms of your patient, once you know the symptoms of the remedy, how do you find the right one for your case? And that's the practical methodology of homeopathy. So first, the translation of the paragraph in question. This is my translation. So you can see the points there. Search for the specific homeopathic remedy. It doesn't say the simillimum, it uses the word specific. Compare the totality of signs of the natural disease with the listed symptoms of the available medicines, especially fix one's eyes on the signs and symptoms of the disease case that are more striking, special, particular, uncommon, truly distinctive. The parentheses are Hahnemann's, but the brackets are alternative translations from the German. Okay. So fixes one's eyes. We're talking about perceivable signs and symptoms, right? We're not introducing any theory. We're not introducing any biological ideas, but just what is perceptible. Rest of the paragraph. Above all, these symptoms must be very similarly matching the symptom list of the search medicine and that is appropriate for healing. It's the law of similars, right? Matching. The symptoms that deserve little attention, since they are seen in almost every disease in medicine, are the common, general, indistinct, indefinite, and indeterminate, undefined. For instance, and these are Hahnemann's for instances, loss of appetite, headache, weakness, restless sleep, discomfort. That is common symptoms. This goes for the mental symptoms. What person doesn't have an emotion? You can't just expect to do homeopathy correctly from emotions. There has to be something unusual, something distinct, something odd or strange about the emotional characteristics for it to be useful in homeopathy. All right, this is a translation from the same textbook that you use in class. So we have a problem with translation. First problem is the word symptom. In German, it's spelled the same way, more or less. And symptoms, though, for Hahnemann means subjective and objective, as well as the circumstances or incidences, right? Paragraph 6. Whereas in modern medical jargon, when you talk to a regular doctor, an allopathic doctor, symptoms are what the patient's experiences, and what you can observe, qualities and sensations. So we have you're at cross conversations if you just say the word symptom as a homeopath. In modern medicine, signs are measurable and quantifiable, such as blood pressure and temperature. We don't have to ignore those in homeopathy, but we have a different perspective on what's important. They're not the only important thing. The objective signs are not the only important thing in disease. Okay, so what is the technique? What is the homeopathic methodology? First, we have to get the totality of the disease case, right? And we're not going to talk about how to do that. It's a different lecture from paragraph 82 to 103. Then in that same section is a paragraph 104, which says to take that totality and then do something with it, something that's unique to the homeopathic methodology. So here we have to be very careful what we do, because no other system of medical therapeutics takes these next two steps. So here's the original German words that Hahnemann says of what to do, the action. These are verbs: to durchschauen and to herausheben. Okay, you have to do these two things, and then you can search for the specific similar remedy. And then you know what the characteristic symptoms are. So we need to explore this in a little bit more detail. What is durchschauen? Literally, get a German dictionary. You have durch, which is through, and schauen, which is a type of seeing. So you see through the totality of the symptoms. You can't do this unless you have the complete totality first. Then you look at the totality and you see, what does that mean? Durchschauen. So we have, when I looked at all the other English translations of the Organon, we have lots of different words. So I looked at all the English words and chose the word transpicuous, which is a more literal word meaning see through. Trans and spicuous meaning see, and trans means across or through. A transpicuous recognition of the unique wholeness of each person's dynamic attunement. A lot of words. This is an attempt to explain a skill that homeopaths gain through experience only. There's no way to master the skill unless you do cases. You are seeing through the totality. And you pick out, once you see through the case, what's important or characteristic, you pick those symptoms out, herausheben. And an English word for that, for picking out, is make conspicuous the characteristic symptoms that are now perceived. So you can't just choose a few symptoms and decide those are the characteristic symptoms. You have to do something else. You have to know the characteristic symptoms. Know is, has a couple different words in German, but knowing means through experience, through perception, not knowing through some intellectual theorized conception. This is things that you actually see, perceive, recognize, without introducing anything in between the perception and the seeing. So you need a transpicuous perception of the gestalt, then make conspicuous the characteristic symptoms. What in the world is a gestalt? This is a word Hahnemann uses. It's in down there you can see it's in 4 different aphorisms. It's no longer, and you look it up in a dictionary, it's no longer considered an English foreign word, so it's not capitalized anymore. And this is because of the widespread history of Gestalt theory and Gestalt psychology that developed in the early part of the 1900s. Okay, so it's still around, evidently, and so it's still a common word in English, but it is a word that means something totally different now than it did when Hahnemann used it. When Hahnemann had used this word as a sideline, I can say it's after the way Goethe used it, but let's not go into that. So when Hahnemann used the word, the old translations of the Organon used the English word form or shape, but the new translations, like Kunzli, don't translate it. They just use the word Gestalt. And people then might jump to the conclusion that it has something to do with Gestalt theory and Gestalt psychology. It does not. So Hahnemann's Gestalt is another synonym for totality, the word totality. There's at least 7 different German words that Hahnemann uses for the term or the idea or the teaching of totality. It's not a totality, it's merely the sum of its parts. This would be an arithmetic sum total. It's not that. But more probably what we have to talk about here is it's not a total that is more than the sum of its parts. A lot of holistic doctors talk about that. And in Gestalt theory, it's improperly translated as the whole is more than the sum of its parts. That's not what the German words exactly say. It's something different than the sum of its parts, not something more than. This is the better translation. Anyway, if you use this idea in holistic thinking, that the whole is more than the sum of its parts, you have this mysterious unknown that, what is it that makes it more? And that makes it an unknown that everyone then adds their own idea into this unknown quality. We don't want to do that in homeopathy. Don't imagine, fabricate, or theorize, or conceptualize. We don't want to do that. So the whole is not more than the sum of its parts. It's a whole within the parts, and each part is being the whole. The part can't exist without the whole. The whole is expressed in each part. Okay, this is different. So a Gestalt in Hahnemann's time is the totality, but let's take some examples of what a Gestalt is. It's not just two-dimensional. Here's a random picture. Say you're in a museum and you're standing in front of a picture in a picture frame. You can see the whole picture, more or less, because it's two-dimensional, standing in one position. However, if you want to see a sculpture in that museum, you have to walk all the way around it. You know, like what's over here on the left side, and what is the person or entity on the back there? What's in the back? You need to walk all the way around it. It's multi-dimensional to see the whole, and that's the implication of a Gestalt as opposed to seeing a totality. It's a multi-dimensional, perceivable whole. Okay. All right. So now we know that totality is more than just a list of symptoms. It's a Gestalt. And in that Gestalt, we have to see something else in it. Well, in modern language, I often see homeopaths say case analysis. We're going to do a case analysis after you've got the totality. However, this is language from linear reductionist thinking. In actuality, the patient presents with the complete wholeness of disease before we do any investigation. The whole person is there, the whole disease is there already. And the practitioner then takes the case, as we commonly say. Maybe we should say give and take the case. Anyway, you take the case, proceed to divide all the parts of the disease into its signs and symptoms and circumstances. That is an analysis. So the taking of the case is really just the analysis. What we do with the case is something different. In an analysis, we're just discovering the pieces of the whole, all these little jigsaw pieces. And if they were all separated, you wouldn't see the whole. Then some homeopaths say, then you do a synthesis. You've got the analysis, all the pieces, then you put them together in one possible way, and you call that the synthesis. So merely adding together a few signs and symptoms into a new sum total is not a Gestalt, right? It's not the wholeness. It's not a multidimensional wholeness. Instead, we in homeopathy do a singular Gestalt, a unique Gestalt, individualized Gestalt. Each case is never before seen in creation, right? This is the assumption of individuality. One of the cornerstones of homeopathic principles, or assumptions, if you will. Everyone is totally different. I mean, we've got the fingerprint on your right thumb is different than the fingerprint on your left thumb. No one's fingerprint is the same. Stars in the sky, no two stars are the same. Why is it so hard to decide that everyone's disease is unique. So the true characteristic symptoms of a case are a singular gestalt, a different wholeness that no one else has. And if you want to go into it, no remedy has it exactly either. We don't do sames. So from all the tools, we got 40 remedies. Say we're on an airplane and there's an emergency and you got your little kit, you only have 40 remedies, you still pick the best or most similar remedy that you can. You know, if you've got 4,000 remedies in your office, it's still never going to be a perfect fit. We just do the most similar. I mean, how many species are there of life out there? Say around 8 million. How many minerals and metals and things from the earth are there? 4,000 some. So how many useful remedies do we know about? We use in the hundreds. I know that some people claim 5,000, 8,000. You know, in practical terms, there's enough information on only a few hundred. So we're only doing the most similar to the uniqueness, the best of our ability with the best tools that we have. Anyway, you choose the symptoms that make that disease case unique. That's the singular gestalt. And how do you find it? Well, it's hard to describe unless you do it. So here's some words: receptive humanness, accuracy of observation, equanimity. Hahnemann uses the German word there in parentheses, which can be translated as equipoise or equanimity or balance. And you have to do this without prejudgment. What does that mean? You don't know what you don't know. Your theories are not going to help you. What you did in the last case of rheumatoid arthritis, you don't know if it has anything to do with this case. Without preconception, that's hard to do. Beginner's mind, Zen mind, child's mind. These are things that you have to unlearn from your scientific training. Here's an attempt at a visual examples. So analysis then, each one of those pieces of the jigsaw are the signs and symptoms of the disease, right? You've taken the whole disease and found all the pieces of it because you don't know it. You have to discover it, investigate it. So that's your analysis. And then you decide to put some of them together to make a so-called synthesis, right? You have in your mind the idea that the wholeness should be a square, a nice, perfectly fit square, and all the other pieces you can ignore, and you call those the characteristic symptoms. That's just a simple synthesis, one possible totality, not the unique gestalt. But what's a conspicuous perception or recognition? There's other dimensions to the jigsaw puzzle. It turns out there's a picture, you know, a perceptual, another level of perception. Turning over the puzzle pieces here. But, you know, it's the idea, what you have to do in your mind. So you can have this totality, this is a nice rectangle on this enlargement. It looks like it fits together very nicely, but it's not the unique gestalt. It doesn't make sense. It doesn't ring true. It doesn't feel right. You don't see something meaningful. All these different words, depending on the case and how your own mind works. It's not the right synthesis. So then you have to have a nonlinear thinking, tangential thinking, holistic thinking. You have to have a fluid mind and put together pieces in different ways until you see a totality that makes sense, that's real, that's useful. How do you know that? Well, knowing materia medica helps. Knowing what's usual and common in disease helps. And you look for the unusual, the unique, the things that stand out. That makes the homeopathic totality. And then you have the singular gestalt. These are the true characteristic symptoms. Okay. I don't know if that helped. That kind of visual little model there. The homeopaths don't think in straight lines. You know, if if so, you'll be limited in your results. Sometimes you do think in a straight line. Sometimes you just go straight ahead and take a simple totality. You know, put those symptoms on the repertory and add them up, and the one that has the most numbers, that's your choice. That's not always the case. You have to think multi-dimensional. Sometimes it works, sometimes it doesn't. Well, Hahnemann gives us guidelines how to help us recognize with descriptive words what's really characteristic in a disease case. Okay, so the word characteristic in German there is in several paragraphs. Alternative translations of the word characteristic are those distinctive, differentiative, striking qualities. Qualitative, right? Qualitative. Then he further describes characteristics in different paragraphs. In one paragraph, he calls them starken, which is translated as strong, powerful, intense, or prominent. Any of those? I have, 3 different German dictionaries. So you can get different English words for the same German word. Which one did Hahnemann mean? Remember, he was a linguist. He knew, at least 9 different languages. He uses lots of different words, so we see the fullness of his teaching, all the aspects. What was the example I used to give in class? Let's have you have a diamond ring with a lot of facets. You don't just look at it like this. You turn it into the light this way and that way, and admire it from all different angles to see the whole beauty of it. Well, that's how Hahnemann uses his language. Doesn't have one word with one scientific meaning. He has lots of words to get across the fullness of the teaching. So starken is one word. Here's another word. Auffallendern, which can be translated several different ways as well into English. Sonderlichen. Look how many different translations you could dig up from that word. Untergewöhnlichen. So unusual, uncommon, abnormal, odd, extraordinary, rare, strange. Again, another word. Peculiar, strange, idiosyncratic, individual, odd, and tired of, so a little color in this one. Characteristic signs are besonders, paragraph 178, right? When he's talking, it's not only paragraph 153 and 154 where he uses these adjectives, but also paragraph 178. Particular, special, specific, peculiar, distinct, singular, right? Something you don't usually see was that little visual aid is supposed to represent. And here's like a little table of a lot of the words translated to some of the English. So forget, it's in the textbook, by the way. Let's find it there. So forget, rare, strange, peculiar, or whatever, odd, unusual, and uncommon. Whatever words you learn as a summary of characteristic symptoms are inadequate. This slide emphasizes the idea that there's no shortcut. You can't figure out the characteristic symptoms, which are a subset of the totality. You can't figure it out unless you have an adequate, total, complete totality first. You can't assume it's only going to be one symptoms like the pathology, or it's only going to be the causation, what started it. You don't know until you finish taking the whole case. Then you decide what's going to be characteristic. Right. So some homeopaths, it's a teaching tool, but we have to realize the limitations of it. Rank certain characteristics as more important than others by hierarchy, where at the top is mental emotional symptoms. So they're always the most important according to these doctors, these homeopaths. And then a little bit less significant, less characteristic in importance in are the whole person physiological symptoms such as body heat, energy levels, food, sleep, sexual status. And at the bottom are the local symptoms and pathology. This is a hierarchy, a fixed linear order. The local symptoms in this way of thinking can never be characteristic unless you have a system of about like 7 underlines, right? We have the hierarchy had about 7 different statements. So how can this one at the bottom ever be a characteristic symptom? It can't unless you have some type of complicated underlying symptom that allows you to intensify the local symptom to be as important as a psychological. This is not what Hahnemann describes. Hahnemann describes what we could call in modern times a holarchy. And by the way, the therapeutic order, and I've talked with Dr. Edwards about this, and she doesn't teach it this way, but in your textbook, it's a linear order, a hierarchy. That's not 1 through 7. No, it should be a holarchy. You don't, the most invasive ones might be what you have to do first, not the least invasive. Depends on the patient. It depends on the disease. So it should be equal access, so all 1 through 7 on the therapeutic order. I'm shorthand for the nature passage. It shouldn't be a linear hierarchy where you always do number 1 first and number 7 last. No. Same thing with characteristic symptoms. The mentals aren't always, the top of the line, or the most important, or the most characteristic. Any sign or symptom can be characteristic, and then you don't know until you're done with the uniqueness of each individual case. All right, what about mental emotionals? Sorry, Leanne isn't here. All right, so we have a huge movement, put it on, in homeopathy that only the mental emotional symptoms are needed to find the characteristic symptoms. Where does this come from? Besides the rejection of materialism. So I went to the opposite way, which is non-material stuff, but there's support for it in homeopathy is in paragraphs 211 to 213. Right, this is how to treat mental and emotional diseases, that unit, that part of the organon. It goes to 230, there's more to it. But what does 211 to 213 say? It says the main ingredient of all diseases is the changed mental and emotional state. It's so important that they're often decisive in choosing the homeopathic remedy. And one never cures unless one looks to the mental and emotional symptoms. This is the translation from those paragraphs. So you could say, well, of course, then all I need to know is the mental emotionals and I can decide the remedy. But this is not what Hahnemann is saying. Remember, this is a couple hundred years ago. There was no science of psychology. There was no field of psychology for Freud, for any of those people. So Hahnemann had to emphasize that part of the wholeness of a person is their mental emotional symptoms. They weren't just imaginary and you can ignore them like even most regular doctors do now. So he's emphasizing that you need that ingredient to get the wholeness of the case. You have to have it, just like you have to have the modalities, and you have to have the chief complaint, and you have to have the past history. You have to have the mentals and emotionals. And they're important. They're not just subjective or someone in someone's mind somewhere. And that's what these paragraphs are saying. Are they always characteristic? You need to know them, what Hahnemann says, but they are often not the only necessary symptoms of the singular gestalt of the whole disease case, which is the point I was trying to make with the skin thing. It was appropriate that if that's what you decide was truly the strongest thing in the case, then you use it, the mental, to decide it. But you can't assume that. You should do the representation. You should repertorize the physical symptoms too. And Dr. Burke brought up, you need the modalities since this causation, since this event in her life 12 years ago. Maybe the other physiological symptoms change, not just the skin. You need to investigate those too. So certainly in the repertorization, we added anger, suppressed anger, but that's not enough. It's not the whole gestalt. So in summary, the determining of the characteristic symptoms is not just a truism or a cliche of the homeopathic methodology. It's a skill unique to homeopathic medicine, and the full process must be carefully followed for consistent results, says Hahnemann. Okay. Any comments, questions? Okay.
What do you think about acute care? Because right now, wherever you go, like she talked about Untitled Chapter. So what's your perspective, like, since it doesn't address the totality of the symptoms? Is that right?
So,
Like, if you look at homeopathy.
so you have to, you have to judge the intensity or the strength of the symptom. So if I hit my finger like that, I'm not going to take arnica, right? If I, fall, trip over this and fall, and I hit my head and I'm unconscious, it doesn't matter what remedy I took this morning for my constitution or my whole person, give arnica right away. So you, at the given moment, we're dynamic. At the given moment, you have to decide what is the thing that needs to be treated. Like I had a patient with a neurodegenerative disease. Right? He's losing all his feelings in his arms and legs. So I give him a big workup and decide on a remedy, takes the remedy in the office. He walks outside, he slipped on the ice, and he broke his ankle right in front of our office. Right? Well, he had neurodegeneration. He couldn't even feel it was broken, but his foot was hanging at something weird. So I, run out there. I can't lift him up. So I get a blanket and a pillow, call the ambulance. But immediately, it doesn't matter if 5 minutes ago I gave him zinc and metallic, I give him arnica right away. Right? The body turns its attention to the thing that's happening right now. And if it's more intense, sometimes the body alternates. I didn't know the whole case, but you had a kid that was screaming, terrible personality, yelling, and you could hear it down to the whole office, and you gave him chamomile and he would calm down, but he had injured his arm. As soon as he calmed down, he complained about the pain in his arm. So then you gave him arnica. As soon as he felt his arm was better, his temperament came back. And he's screaming and yelling and running down the hall and acting out, and you gave him chamomile again, right after each other. So you go by the moment. What's most prominent? So, if I fell and I'm unconscious and I'm not breathing, that's part of the totality. If I fell and, and I'm screaming, that's part of the totality. So the totality is the obvious symptom of a head injury, but maybe there's other symptoms with it. Like, did I turn blue? Did I turn red? Did I stop breathing? Did I breathe fast? Am I sweating? That's the totality. Sometimes you don't have it. Then if some symptoms are so prominent, then you just prescribe on that.
So you mentioned that you won't be able to know what's truly characteristic until you have experience. So do we in the meantime, use our repertoire to tell us?
That's right. But don't do it like this is the number one remedy, the far left of it. Don't just go for that. Look at some of the other choices. Make sure you know what the materia medica is on all the choices you see up there. And, maybe you'll learn more materia medica, and you won't always choose the common remedy that comes up all the time. But until you have that knowledge and experience, you do the best you can.
I just wanted to comment. I love that you had the picture of the puzzle on there. That really, for me, a lot of times with remedies, when I'm getting it wrong, I think like, oh, it's because I'm doing something wrong. But I could be looking at the pieces, and the pieces could fit, but I'm not seeing the whole picture. So it's not necessarily that I'm doing it wrong. I just need to move a little bit farther. So I really like that.
Well, thank you. That shows, the complexity of a living human.
Mm-hmm.
Is that, going back to that example where you put the four pieces together, it's a panda bear, that was right, but then you put four pieces together and it's not. That's like a simile when you describe simile. It looks good, the pieces fit, but it's not right.
That's right.
But like a simile.
Yes. So people use that analogy of a target, like bow and arrow target with the colored rings. So there's a group of remedies that will always react, but only one will do the best. So when you hit the target, but not the bullseye, you have to decide, can you do better? If you can't, you just do the best you can.
And sometimes, it comes up, sometimes you find characteristic symptoms, but it's not in the materia medica. The person has some weird craving, and you look in the materia medica, you look in the reference, or in all the literature, you can't find it.
Right.
So maybe there's a remedy that hasn't been proven that has it, or that isn't known well.
That's right. So then you have to use your experience. Like fear of monsters. You think that would be in the repertory? It's not in the repertory. Oh, no. That's fear of clowns, right? Pretty common, but it's not in the repertory. So you have to look under monsters. Right? So you learn how to do that. Or like instead of annular, you have to think what are some synonyms that might be in the older language. Circular, who would have thought of saracenate? But you know, you have a synonym dictionary in the repertory. You can. Yeah, right. Maybe you can show. Up and there it says search words, and then there's synonyms.
Oh, under the search menu.
Yeah, yeah.
Continue. Search, the repertory search, yes.
Synonyms. Yeah,
No, it wasn't asking for synonyms for what?
no,
Like when you do your search word.
Right.
Search.
Oh, sometimes if I'm thinking of a certain remedy, but I'm not sure if I'm either putting the symptoms in right or, okay.
Here, this is what we're talking about. Search for words. Words.
And no, not just words.
And see, it says synonyms. But here I have to put in, let's,
You can do that. but-
depression. Put in the word depression. That's not in the repertory.
synonyms. Oh, there you go.
Oh my goodness, you see the second part? You, oh, we've been doing this?
I don't use it very often. I could, I was.
Hey, Tim, do they have that in written?
Cow, depression, cow? Like have a cow. You're gonna have a cow. I don't know. That's a good one. Damp, dark.
Tim, put it annular or ring light, see what it says. Like ring light, annular.
Did you put, she just gave me a situation, but sometimes you can't do that. So like if you look at guilt, you're not gonna come up with anxiety and conscience.
Right. You want me to put in guilt?
Sometimes it doesn't help. You know, you can look at a thesaurus to get a synonym. But it's not gonna give you what the repertory calls it.
That's right.
So here are the synonyms for guilt. Yeah, there's no.
It's not gonna help you.
So there sometimes the repertory helps you because if you look under, I think if you look under guilt, it'll probably tell you in this repertory at least, it depends on your repertory. On this repertory, if you look under guilt, it'll probably have a cross reference, a blue cross reference. Yeah, it says anxiety contents. So you hope your repertory is smart enough that it, you know, it's got all those connections.
What if you have something like trichotillomania, or like your head? They like people like eat hair or something.
Pulling hair.
Pulling out.
Pull. Yeah. So I think you're looking at hair, mind, hair, pull. Pull one's hair.
You just have to think of synonyms for yourself. Every possibility. Touching, twirling, pulling. Hopefully you'll find it.
But that's a great function under search, words, synonyms. Yeah. I'll give you other ideas, things to
I
look.
was just thinking too, as we were going through this, that might be something that AI, you know, as we're talking about using that, and we say it, and then it can tell you the other thing.
Yeah, exactly.
And then even if you say it can say, well, in the old German, it used to be these, so it can give you some Hahnemann era.
Yeah, kind of like what Hahnemann did in his mind, but AI kind of doing it for us.
The ultimate thing would be just to talk to the repertory and say, repertory, I need a remedy that pulls hair and is guilty and desires apples and has reddish brown lesions. And it will navigate all the language, but yeah. It's complex. It's complex.
That's true.
I was going to ask, did Hahnemann only write in German, but he knew all the other languages? Or?
So he wrote in other languages, but not English. Even though he translated William Cullen's Material Medical, which was in English. So when Herring was still alive, so Herring did the first American English translation, and Hahnemann approved of it. But Hahnemann never wrote in English.
Never wrote in English?
He never wrote anything in English.
But he knew English.
Yeah. Because I think he worried about translations, just like we worry even more about it. Words like gestalt, words like symptoms, how they've changed meanings over the years.
Well, I have a lot of cousins in Switzerland, and they're always like struggling. They're like, there's just not a word for that in English. Like a lot, they say that. You know, there's so much of a problem with the translation.
Maybe he felt it was an imperfect language that didn't want to express himself.
Yeah, I think so. I've heard that about German. It's a lot more expressive than ours.
So they say, you know, that English and Latin are static languages. Greek and German are dynamic. What does that mean? In German, the nouns are also verbs, whereas in English, they're not. So the Gestalt is not a thing, it's a being or a doing or an action. Or, and when I taught it, miasm is especially the biggest example. Miasm is not a noun. It's to miasm, to be miasm, a miasm process. And English speakers don't get that aspect. And so we have all these ideas of what miasms are that are incomplete.
It's a static thing. It's a process.
It's a process. All right, I'm just, oh, go ahead.
So about your hierarchy and hierarchy, so you said that there's sometimes a time where you don't do one, you have to jump to several. But, and how does that work in homeopathy? Because every time you give a homeopathic remedy, no matter if it's calls for an emergency situation or not, like the guy that fell, you still gave him arnica, even though you're going to send him to care. So like natural, we still create conditions for health, no matter what we're going to do. So I think I was kind of confused on that.
So let's say an injury, right? That's not a mental, at least at the beginning. That's a way at the bottom of the so-called hierarchy. It's a local symptom, a local injury or trauma. So you're only prescribing for, why is that the characteristic? Because it is the center of the problem. It is the characteristic of the problem. It's an injury to local tissue. So some people have older person effects to arnica. So for instance, if I give arnica by mouth to a marathon runner, before they run the race, they're going to do poorly because it gives them arnica symptoms. It cools their blood, it makes them, the muscles relax. And they don't do as well as if don't take arnica before you're doing an athletic event. Wait till you have some symptoms. It's unlike what Joe was talking about, preventing surgery. You know what's going to happen, so then you can do some prevention. But otherwise, you'll get whole person results from any remedy, even trauma remedy.
I remember a story of a person running a marathon, and they did exactly that. They took arnica before, and they had finished, I think, every marathon. But after taking the arnica, halfway through, they just got tired and went on the sidewalk and fell asleep.
Wow.
Didn't continue the race.
Yeah.
So that, taking arnica was, they proved it basically.
Right. Or I could think about our son. We used to live in an apartment. My son had a big head. He fell off the bed head first, bam, right on the floor. And the neighbor from downstairs ran upstairs because it knocked out her light fixture. Wow. So it was a big. So I ran to get arnica 200, and after that, he fell down more often. It made him clumsy because it was too much. He just needed to his head was really hard. All he needed was a little bit of arnica, perhaps. But if you overdose, even the right remedy, you get a pooping. His head is still in one piece. He's okay.
He's a college professor now.
Yeah. Thank you. I didn't do it right, Tim, to log out.
Next, Dr.
Let's see if we have any questions on the webinar. No. I'm going to mute. Elizabeth, Amishi, you guys got anything you want to say?
Wow, thank you. What a great program. I like.
Oh, and Elizabeth, have you looked at the email about bringing Andre?
Yeah, I support it. I do support it. I haven't heard him before, so it'll be good to hear him.
Okay. We're working on bringing Andre to national in October. Go ahead.
I was just going to say, last week when you first sent out the email, I thought I responded that I was for it.
Okay, maybe I did. maybe you were one of the first responders and I didn't see it.
I'll make sure to
Thanks.
check though. I'll make sure to check though.
No, good. That's why I asked now. Okay,
Yeah.
cool. Thanks, Elizabeth.
Thank you.
All right, I'm going to end the webinar now.
Thank
Mishi,
you, Dr. Spear.
Everybody, the last one, the next one.
Oh, the next meeting is March 16th, 2019, right here. Hi, Mishi, what's up?
Oh, I'm blown away at today's presentations. I'm speechless. It was so inspiring, all of the presentations, and I'm really.
I think it keeps getting better and better.
Yes, and you know what? I'm going to send these recordings, if you don't mind, to a few of the homeopaths I know, because they have no idea what they're missing. Because I don't think anybody's aware of what's going on, in fields like what Joe is doing, and all the new stuff that's coming out. So
maybe send me an email I can on Dropbox. I can share the recording with you. So send me an email.
Okay.
To remind me.
Okay. Sounds great, doctor. And
yeah, cool. That's a good idea.
Yeah, and we'll just keep in touch, Dr. Fears, for the membership, and then about the website, listings and all the, the payment button that we talked about. So
yes.
If you get a chance to connect with Eric, maybe I can touch base with you in a month or so.
Okay. And if that doesn't happen, just send me an email to remind me.
I will. Yes.
I know it's in the minutes, and it's just I've got that. It's on the to-do list.
Yes, absolutely. I will do that.
Cool.
Happy Thanksgiving to everybody, and have a nice holiday.
All right. Happy Thanksgiving to you, and happy Kwanzaa, Christmas, New Year's, all that too.
Yes. Thank you.
All right. Take care.
Okay. Bye-bye. Take care. Bye. Bye.